Madam Mayor, it's 6 o'clock and we are live. You're on mute.
Good evening, everyone. I'd like to call this Tuesday, January 19th, regular City Commission meeting to order and ask the clerk to call the roll, please.
Mayor Pam Triolo,
Here.
Vice Mayor Andy Amorosa,
Here.
Commissioner Scott Maxwell,
Here.
Commissioner Carla Blockson,
Here.
Commissioner Herman Robinson.
Here.
Thank you.
Everyone would rise for the invocation led by Commissioner Maxwell.
Lord of all creation, we come today to honor you and to remind ourselves of your pivotal place in our lives. We ask for your blessings on this meeting. We ask that your wisdom would guide us as we seek to accomplish the goals on today's agenda. Thank you for the opportunities you give us to serve you and to serve others. May our actions and our attitudes please you this day. We pray these things in your mighty name. Amen.
Amen. Commissioner Blockson, would you lead us in the pledge, please?
Pledge allegiance
To the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Are there any agenda additions, deletions, or reordering?
No, Madam Mayor.
There are none. We will move on to our presentations. The first of which is a COVID-19 update presented by Dr. Alonso. Welcome.
Thank you. Thank you so much.
Let's see if you're still on mute. Can you do it manually, Doctor?
Yeah,
There you go.
I got it. I was just trying to get to my data. I've got it all over the place.
Well,
So,
welcome. We're so glad you could be here with us today. We know you're very busy right now.
My pleasure to come. I wish I would much rather be doing these kinds of meetings than meeting with representatives from crazy other sections of the world. So this is much more pleasant. Thank you very much for having me. I really appreciate it. And I'd love to give you some data on what we've been doing in terms of stopping the spread of COVID in Palm Beach County. As of today, our total numbers for Florida are 1,589,097 cases. That's 9,816 new cases. It's pretty much the average that Florida's been having now. They were above 10,000 cases per day. They're down to about 9,000 some cases per day. That's a lot of cases. In terms of hospitalizations, they got 68,478. That's 308 new patients for the whole state. And for the deaths, it's 24,436. They're averaging about 100 and some cases per day, but those numbers get reported on the day of actual death. And so our actual number of deaths has been going down over the months. But you know, in terms of deaths, any one death is way too many. We really want to stop the number of deaths that we're having altogether. For Palm Beach County, our numbers are 98,692 with 625 new deaths. New cases. And that number has been averaging around 600, which we're very happy. At the press conference, at the Board of County Commissioner meeting that I had last month, I hired new contact tracers because we were doing about 100, 200, started going up a little bit. And I said, by January, we'll be seeing 1,000 on an average day. We got up to 12,000 in one day. And I was really afraid that I had underestimated the number. But thank God that with the help of all the people in Palm Beach County that have been doing the right thing and maintaining their masks and maintaining the distances, our numbers are averaging around 600 per day. Our number of hospitalizations, we've added 15 new hospitalizations for a total since the beginning of 5,386. And we have 2,059 deaths, which is an additional 15 since our last report. The things that we're tracking very closely, obviously, is our daily and our total positivity. The daily positivity is how much virus is in the community, and the total positivity is how many people we have that are positive. So our total, our daily positivity is 9.47, which is above the state's, which is 8.97%. We wanted that number to be below 5. I think we said that last time I came to talk to y'all. We talked about how important that was, because anything above 5, we cannot do good contact tracing. We have not been at 5 since before October. And our daily positivity has continuously been going up. So we're now up to 15.02%, just below the state, which is at 16.47. So those are not good numbers. However, our cases are maintaining in that 600 level, and our deaths have actually decreased a bit. Our hospitalizations, which is something that we're very concerned about, because it's, I mean, in California, you know, they're having to have cold storage refrigerators because the bodies are stacking up so fast that the morgue can't keep up with them. That's a very sad state for a hospital to have to do that. Very fortunate for us here in South Florida, even though our numbers are very high, that is not happening. Our total hospitalization utilization is at 76.9%, which they like to keep below 75. And our ICU beds are at 73.1%. Again, the reason that is so important is that it's very time consuming for COVID patients in the hospital, whether they're on the floor or they're in the ICU. So right now, the percent of ICU beds is above 25%. As a matter of fact, on Monday, it was 27%. That means that more than a quarter of the people in the ICU are COVID patients. The COVID patient needs a 1-to-1 ratio for nurses. That means that nurse is there with that patient the 24 hours that the patient is there. It's very intensive, and therefore you require more staff to keep those people in the hospital and keep track on them. Our ventilators have never been a problem in Florida, or in certainly not here in Palm Beach County. And we know that we're using less ventilators now. So all these things together let us know that we're very high positivity, a lot of virus in our community, a lot of people that are positive. But I do want to thank all the citizens that continue to do the right thing, their civic duty to protect themselves and their community by wearing their masks, washing their hands frequently, and watching their 6-foot distancing. That is so important. If it wasn't for these heroes that every day continue to do this, we would be in much worse shape. So thank you, Lake Worth. Thank you, Palm Beach County, and everybody that's listening to us. Now, our progress for the COVID vaccines. Right now, as of today, we have vaccinated 93,000 people, 93,563 people in Palm Beach County. That's 70,000 more people than the day before yesterday. So we're vaccinating about 7,000 people per day in Palm Beach County. In Broward, they're at 96.583%, 96,583, which is only 3,000 more than us. So very soon, by the end of the week, we're going to surpass Broward. And think about it. They got their vaccine, and they've gotten a lot more vaccine, and they've had that big drive-through that they're using that should be helping them a lot. So we're going to start working very closely with the healthcare district and some of our other community partners to give the most attention to that big list that we have of the people waiting to get the vaccine over 65. Since December 29th, we have received over 200,000 requests for vaccine appointments. As those appointments are requested, they're received, and we have been putting them in just hold, and then calling them, emailing them, and getting them appointments. So if I'm only getting about 4,000 vaccines a week, so you can do the math, right? That will take a very, very long time. So what we've decided to do is work with our community partners, especially the healthcare district, and we're going to just take those lists, divide it up, and just give appointments to all of them. As of this afternoon at 4 p.m., we have deactivated our CHD 50 feedback at floridahealth.gov email. That email will no longer be available. And we're just going to not take any more people calling in or putting appointments. We're going to give that 200,000 people, we're going to give them actual appointments. And depending on the availability of the vaccine, we're going to get them all vaccinated. After we finish that list, then we will get a web-based system that they will be able to call in depending on what site they're going to. Today, the governor announced that 67 Publix location in Palm Beach County would now receive vaccine. They're going to be doing about 125 per day. This is going to go up on in a few days. Their appointment is also a web-based appointment. It's www.publix.com/COVID vaccine. So you get on that website and you schedule an appointment. If you do not have an appointment, they will not see you. Do not go to Publix without an appointment. You're just going to clog up the line. Please tell that to all your folks. So that is what we're working on right now in terms of distribution and making sure that we get all those folks over the age of 65 appointments and continue to work with our healthcare providers and other folks that we're also vaccinating. So we're reaching that end of the tunnel. We know that the light that we're seeing is not a train, it's an actual exit to the tunnel, but that process is going to take another 6 months for sure. And the people that are getting the vaccine still need to wear their masks. They still need to take all the precautions because we don't know yet how long that immunity will last. It won't be until all these millions of people across the country and across the globe test this vaccine out further that we will know how long that immunity is good for. And that happens with every new vaccine. So this is the normal process of how vaccines are done. So I want to tell everybody the most important thing is to continue to wear your mask, wash your hands, sanitize those touch surfaces, use your sanitizer when you can't wash your hands. And the most important thing is to watch your distance. Maintain the 6-foot distance from everybody. Everybody that you come in contact or that you see next to you, assume that they are positive. Remember, there's a lot of positive people out there that are completely asymptomatic. They're not coughing, they're not sneezing, but they're spreading the virus. So please don't get complacent in these last few months. Keep your guard up. Don't get sloppy. Your mask, washing your hands, keeping your distance. I'm happy to ask any questions. I don't know if you do it before or after, but I'm around for questions.
Okay, thank you so much, Vice Mayor. I saw you had your light on before the battery died.
Yes. Hi, Doctor. Welcome. Happy New Year. Good to see you again.
Likewise.
A few questions. So people have asked me if I would take the vaccine, and for public record, absolutely. But I have a problem taking the vaccine before my elders get it. And I've gotten a lot of calls from the elders in the community. Are there any conversations you're having? I know Publix just started or will be starting soon. Is there any conversation with the fire department or anybody to do outreach that would actually go into the towers, go into some of the eldered areas in Lake Worth Beach?
Yes, I very much want to do that, but right now, first of all, we have to follow the governor's executive order, right? We can only vaccinate healthcare workers. Those can be under 65. I got my vaccine. I qualify for a couple different reasons, but I made sure that all my real doctors got their vaccine. Like my grandmother used to say, I wasn't a real doctor because I didn't have the office and the stethoscope around my neck all the time. So to her, I wasn't a real doctor. She would not have given me the vaccine. But my mom has not gotten the vaccine yet. She's 92. I have not wanted to put her in line, making anybody think that I'm giving her preferential treatment, but she does qualify. She will eventually get her vaccine. But it's really a matter of sufficient vaccine right now. So we're really concentrating with the healthcare district doing large volume at sites they're going to be in the Civic Center. They're going to be up at a different location. And then we're looking for another site up north somewhere. Obviously, we've had the south end with the Kings Point and the sites that the governor selected. Those were not selected by us. What I want to do with fire rescue and with other community groups that would be able to vaccinate is to go into some of our high risk minority areas. As you know, there's been a lot of talk about the fact that our minorities are very, very under vaccinated and represented in very, very low numbers in terms of the vaccination numbers. There's a lot of fear among many of our minorities. So one of the things that we're trying to do before we start going out and doing that is to do some community conversations. We're having several town hall meetings with leaders from the different communities that can actually speak to that very conversation. Is like, people who actually want to take the vaccine, like I've talked to El Sol. I said, yes, I'm willing to take the vaccine, explain how the vaccine was actually done, the fact that this vaccine actually put much more minorities into their studies than any other time in history. There's no other vaccine that has had this much effort and actual people in it that are minorities. So there's a lot of myths that need to be dispelled. And at the same time, there's a lot of validation that need to be made that yes, in the past, minorities have been abused in the system. And so we have to recognize that. So there's a lot of work that needs to be done, but the number one factor that's stopping us from doing all of that at the same time is that I'm only getting 4,000 vaccines per week. As a matter of fact, for the next week, I only have 2,925. So a large percent is going to go to the healthcare district because they're doing 3,000 per day as opposed to my 500. So they're getting a larger quantity of vaccine to be able to go into that larger production that they're doing. But as we get a little more vaccine where I can give out to some of these groups that will want to go into the churches and the other groups, I think we can definitely use our fire rescue. They've proven that, I mean, they have a fantastic, we gave it out to 10 out of the 12 had a little bit of vaccine, like some got 200, some got only 50, but they're really very well organized. They have the appointment system, they have their line set up, they have the distancing, they have everything like ready to go. So we can bring them out into the community to do some of these smaller groups. So that is the plan. We just got to get more vaccine.
My next question would be, so with incoming President Biden, he has made comments of trying to get 100 million vaccines out in 100 days. How does that look for Palm Beach County? How does that look for South Florida? Has those conversations happened?
Yes, those conversations are being had, and we know that that is his intention. But we were also told not to expect any different amounts in the next 2 to 3 weeks. So this isn't going to happen overnight. He's got to get production. He's got to get probably contracts into place. He's got to get the whole ball rolling because it's just been absolutely stagnant at the federal level. The state really has not gotten the vaccine that it was supposed to get. This is not a conspiracy against Palm Beach County because we're Democrats or anything like this. It's just simply the state does not have the supply that it was supposed to have. So I give the governor credit. He's really trying different ways of getting the vaccine to Publix to roll that out. We're hoping that will work a little bit better than the CVS and the Walgreens that has not gone so good in terms of the long-term care facilities. And he's really trying to move the vaccine as much as possible and distribute it. But every time he opens something up like Publix, that means we're going to get a little bit less because there's only X amount of vaccine in the state at this time. So I'm very hopeful for the Biden plan. I'm very hopeful that things will start rolling, but it's going to take some time.
And that was going to be my next question. So having the 67 Publix open, that decreases the amount that you get per week, correct? Is that what I'm hearing?
That is both my professional opinion and my expectation, because like I said, there's a set amount of vaccine, so it's impossible. It's just math.
Yeah, the question I have too is that I guess Publix was putting out, or other organizations were putting out that Publix was getting some of these vaccinations, but they didn't put anywhere on some of the ones that I saw that it was for people age 65 and older.
Yes, it's for 65 and older.
I know, I'm saying,
That's an executive order from the governor.
right.
And it says shall only vaccinate long-term care facilities, healthcare workers in direct patient contact, and over 65.
No, I know that and you know that, but some of the people that are talking about it and advertising that they'll be there, it doesn't say 65 or older. I'm afraid people are going to go and show up because they said it's available at Publix and they're going to be able to get it. So I was concerned about that.
Yes, we're asking for proof of age. If you don't have a driver's license, show us something else, because believe it or not, people have actually lied. When they got that little walker with them, they can really get in a fight with you. So you got to be very careful. But we've made it very clear that this is by executive order. It's not that we wouldn't like to give it or not, but and again, we only have a set amount of vaccines. So the fact that he did 65 and older makes that 400,000 additional people in Palm Beach County that we're trying to vaccinate. Had it been reduced to like maybe over 85 or with conditions, we could have narrowed that and made it more manageable. But having a large amount in a phase 1 is mathematically a problem.
So now you said 200,000 people reach out to you for appointments already?
Yes.
Okay, so anything additional of that, or could be people that go to Publix, you're not counting them, or you won't be sending them there, or you'll be doing it through your own resources, correct?
Right. We're going to contact every single one of those people. We are contacting every single one of them. And now a lot of people put their names in 6 times thinking this was some kind of lotto, that the more times you put it in, the better chance we're putting them by the date that they entered the first date. Those repeats are being deleted. Some people also put in multiple emails, but they did it for other people. So a person who didn't have the ability to get on an email, they did it for them. That's fine. We're counting those people and calling them and getting back to them. So everyone that was on that list is going to get an appointment if they're over the age of 65. And if they have not already gotten it, we've asked them, we were asking them to unsubscribe from the email if they had already gotten, but we didn't get a lot of that cooperation. So we know that some people have gone to other counties, to Broward, to Miami, to Gainesville, to Sarasota. They've gone all over the place to try to get vaccines. So some of them have gotten it. And it probably, there's a lot of duplicates in there. So it's probably more like maybe 150 to 100,000 that we're going to give appointments to.
Thank you. And then just one last question. I want to thank you. I want to thank the county and Palm Beach County Fire Rescue, because one of the big situations that we had here in the city of Lake Worth Beach is that when it came to the testing, people weren't going out. They weren't going up to 45th Street and they weren't doing that. But we were very successful in having them here and coordinating them right here within our community at the Osborne Center, at Peniel Baptist Church. We've got some big facilities that can accommodate a lot of people, and we continue to test there today with the help of our partnerships and friendships. We are ready to go and operate that way again. Should, once it opens up to, everybody beyond that point, we would love to continue that partnership and work well with you guys, because we have the opportunity, we have the ability, and we have the locations that work out well for the traffic too. Yes,
we definitely will. It's just a matter of supply and demand at this point. It really is. We have to take advantage of the healthcare district being able to. The other thing is hopefully, if we continue to get this vaccine for the healthcare district to be able to mobilize, they will go to the fairgrounds at some point, and then they'll be able to do 7,000 per week. So that's for the people that can get out. So then once that's up and running, then the other thing that we have to do is do exactly what you're saying, the smaller community outreaches for those hard to get people, those people that can't drive out, those people that are homebound. And we do have mobile units. We do have fire rescue that has gone to, pretty much like we did with the testing. So I see the same model that we did with testing to happen with the vaccine once we get to the point, probably in the next couple months, when we start having that vaccine rolling in, thanks to the president's new efforts and the ability to get that vaccine rolling, which normally happens in that second phase, 2 months after it starts anyway. There'll be more production. And remember, there's new vaccines coming on board. Johnson & Johnson with that 1 dose vaccine, that's going to be phenomenal, right? Because it's just one time. So those studies are winding up, and there'll be more different companies that will also be releasing. So there's a lot of optimism that that's going to start rolling in the next couple of months.
Thank you very much, Dr. Alonso. Yeah. Oh, sorry. Go ahead.
Doctor, how are you dealing with seasonal people? I'm hearing a lot of people that said, I could have gotten it in New York, but I'm here, so I'm going to get it here. Is there any, how are we dealing with, we're a vacation, we're in the middle of our season, people are coming from other states and they're here, so of course they're jumping in. How are we dealing with that?
Yes, that's a real hard question because it's a federal vaccine. So technically, originally we were told we had to vaccinate everybody. Then the governor said we're not going to do tourism, but that's a really hard distinction. So the idea is anybody who's paying taxes in Florida can get vaccinated in Florida. And I think he's referring to not taxes, like when you go to the store. He means if you are paying
Property taxes.
taxes in terms of residency and so forth. So the problem with that is that that Palm Beach County is one of the counties with the highest number of people who have lived here for the tax exemption, right? So we have a lot of people that, even though they come down for their 2 or 3 months, I think it's 3 months that you have to live and then go away. People know that they're coming from out of town, and yet those people do qualify. So we're asking them for their driver's license. For people that don't have driver's license, and for our community of either agricultural workers and or other daycare workers that don't have that, we're going to have to come up with what we did with other forms of IDs to make sure that, those people we know are here, but they don't have IDs. So there's 2 groups of people that we want to be able to accommodate. What we don't want to happen is that people are just coming here to get the vaccine who don't actually live or reside here for some period of time. And that I think we can do with their driver's license. Most of those people are going to have some form. The other group that we have to be very careful with is that in our winter is the summer for South America. And we know that many of those people are coming and they've got their kids in school and everything, but they're only here temporarily. And one person put it on Facebook, come to Palm Beach County. They're really well organized and it's free. And that was on Facebook and for Argentina, all over Argentina. So we're going to have to be careful with all those types of tourists also. And that we definitely want to try to stay away from that. So again, asking for that ID and making sure that they're 65 now while that's in effect.
Thank you.
Thank you, Vice Mayor Pro Tem.
Thank you, Madam Mayor. Thank you, Dr. Alonso, for your presentation. Really good information for us to really get it straight from the source. And
The horse's mouth, yes, you can say
I
it.
wasn't gonna say
He was gonna say that.
but I'd rather hear it from you than rely on social media or other platforms to get it. Even the media itself sometimes seems to be a little conflicted in what they're putting out. So let me begin with the obvious question. You've got 93,000 here in Palm Beach County that have been vaccinated, and that's a start. But how many, just from a demographic standpoint, how many folks in the county are over 65 years old?
400,000.
All right, so in theory, if all of these 93,000 went to 65 and over, which isn't the case, you're almost at 25 or 20% roughly.
She's got 200,000 on a waiting list.
Right, okay. That puts things in context.
A lot of these people were healthcare workers.
I understood.
A lot of it's 95, because all those people got vaccinated in the hospitals. And a lot of our staff from here went to Miami. You can see there's a dashboard for the COVID numbers. And we have a lot of people that have had the second dose already. Almost all of those are healthcare workers that were vaccinated through the sister hospitals or the corporate hospitals down in Miami and Broward.
Okay, well, you bring up a good point. The frontline workers are the folks that aren't 65 and over here in the county. How many would you say of those folks are we talking about?
Maybe there's 25% because a lot of our docs are over 65, so they qualify for both.
Okay, all right. Now, the other question I have is,
There's actually a breakdown. If I were to look it up, you can look on the website. There's a dashboard for the COVID report, the vaccination report. It actually has that for the state. It doesn't have it for the county, but it has it for the state.
gotcha. Now, the other question I have is, that there's been talk of folks that are, either coming into Palm Beach County or leaving Palm Beach County to try to get the vaccine. Okay. Are we able to effectively track that? In other words, if I were to travel to another county and get the vaccine, a pretty good possibility that you're going to know that I got the vaccine. Somebody's going to know that, Big Brother somewhere.
Yes, every single vaccine with your name, age, and where you got it is tracked in Florida Shop. And that is why some of the people that we have did get the vaccine outside, and now they're going to want to come here for their second dose. So we have right now between 100 and 150 people that are getting their second dose that got it elsewhere. We can handle 100, but if it gets into the thousands, we're going to have a problem. So we're recommending that everybody go back to where they got their original dose, because the second dose is going to be based on the people that got vaccinated in that area. So my vaccine is going to be allocated for the number of people that I gave that first shot to.
Well, that's
Now,
my
it's going to work. It's going to work a little bit both ways, right? There might be some people we gave it to that actually belong to Broward or Miami.
Sure. Well, that brings up my next question. That is the availability of the actual second dose. Is the system set up to actually hold back for every person that has gotten the initial vaccine? System set up to make sure that that second shot, I don't know if it's the same composition chemically or whatever, but is the second dose being held in reserve to make sure that that second shot is available?
We were not supposed to do that locally. Now, some people automatically did, but we were not supposed to. We're getting that second dose now. We've gotten the allocation for the second dose. We got 18,000 doses for the second dose, and our first doses are starting now at the end of January. So we have those doses. We're making those appointments. The people should be getting appointments as they get their vaccine. Say you need to come back in for Moderna, it's in 4 weeks. For Pfizer, it's 3 weeks. So we're giving those appointments now, and then we tell them we will call you, give you a reminder to come back. You have a 5-day window to get the vaccine. So if it comes that if we're not open on Sundays and your 4th week is exactly on a Sunday, it's perfectly fine to come on Monday or Tuesday. And that's what we're doing. We're making their appointments for them.
Right. And regarding the second dose, it sounds like you have a system in place for that. What happens if somebody does not come back within that time frame? Is that first dose essentially rendered ineffective and they got to start all over again?
No. The idea of getting the second dose is that your body will make more antibodies and therefore protect you, giving you that 95% efficacy that both vaccines pretty much reach the same amount. And so it's not going to make it invalid. It's not going to be zero, but it will be more efficient if you get it in that time, because that's how it was studied. Now, like everything else, let's say you're on vacation, somebody left the country and has to come back. When that person comes back, we're going to give them the vaccine. Even if it's 30 days later, they're going to get the vaccine.
Understood. Okay. And thank you for that. The next question I have is, in your presentation, there was a lot of talk about web-based access to making appointments and things. You deactivated the CHD 50 hotline, and I guess you're getting ready to ramp up another system, a web-based system. I've fielded, I'm sure we've all fielded, a number of phone calls from folks here in Lake Worth Beach who simply do not have access to a computer, or they're not tech savvy like myself. I have, even though I can do an email, but I've tried literally to take hard copies of the communications that we're putting out at the city level and personally delivering them to folks, but only to find out that really that it doesn't really help them, because unless you have access to an email, you're kind of SOL. Oh, did I just say that publicly? I'm sorry.
Point of order.
I've been saying it a lot, so I forgive you.
I apologize. That was a slip. But, is there any formal system being contemplated to help with these folks that simply don't have, the equal access to the web-based portals?
Yes, about 70, over 71, almost 75% of the individuals, believe it or not, over 65, even some that are 95, have been doing very, very well with the emails. However, because the phone systems are so sensitive, and that's what I'm worried a little, the Publix is going to use the same thing. They're going to use a web-based system. It's not an email, but it's a website that they're going to go. You go on the website, you pick the day you want and the time, and you pick your selection, just like you do now for your doctor's appointment. I had to do the same thing, and I hate it. I wanted to get the call and do it. I know how to do the computer, but I still like to talk to people. So we know that there's been a couple of things. One is community groups have set up and taken turns taking care of their neighbors that couldn't do it by email. So we have several community members that have 10, 15 emails that they have sent out for their neighbors. The other way is that they have had a relative do the sons, the daughters have been doing emails for them. So that's one way, getting somebody else to do it for them. The other way is the actual telephone call. Healthcare district is going to join with 211 to have them be the surrogate for those telephone numbers. The health department, we're still using our appointment line system. The fact that we're going to take 75% of them by email has helped a lot. And so we've added more people to the telephone lines, and they're actually doing a lot of the calling and the setting up of these folks. So once these people are out of the queue, we'll have more room for those telephone calls for those individuals that aren't able to call. In the Glades, all the appointments at the health department are being made by the phone, and because it's low volume, it's being handled very easily. So we need to have that available, and that's very important that we don't eliminate the phone. There's still people that obviously need to do that, but there are ways to get community groups to help for those who can't do it. Maybe the churches and so forth can also help with that.
Okay, that's something we've been looking into in the last week or two, especially. I tell you, after I went to a few homes and spoke with folks, didn't have access. Some folks were literally in tears. They were so upset and so stressed out over this whole process, and I just felt so helpless. So we've been looking into, like you say, putting groups together, hopefully that we can identify folks that could use that little assistance or whatever, and we're going to move down that path. Okay, my last question I have really has to do with the end of your presentation, where you you basically said, look, you see the light at the tunnel, and it's not a train, thank goodness. And we're looking at maybe another 6 months or so, okay? And you also cautioned us to continue to be diligent and to wear the masks, practice good hygiene, sanitation, keep our distance, etc. This is, and I guess my question is, are those standards, are those recommendations any different today than they were in March? In other words, should people have any type of a sense that we can slack off just a little bit here, or should we continue to really be where we were in March when this thing was really starting to ramp up and we didn't know what the heck was going on, and we were trying to figure out how to stay safe?
We don't want to slack off because we have so much positivity. And what I'm afraid of is we have seen this happen several times. You have that senior who has not gone out in 10 months now, and all of a sudden, because they finally decide to go out, their friends convince them to go out to dinner, and they come back with COVID.
Oh my, yep.
And the same thing happened with younger people doing the same thing. We had one lady that was the birthday, the girlfriend came down, and she and the boyfriend went out for the first time. They had had all their groceries delivered. They had had everything, their dog walking, everything was very, very careful. And so they decided to go, where did they go? They went to Rocco's Tacos, downtown West Palm Beach. They were having dinner with people that they obviously didn't know. The tables are right next to each other. You take your mask off, you're literally surrounded by 6 other people who you don't know, and they all came back, the entire table came back positive for COVID. They were so embarrassed that after all this time. So that's what I'm saying. We can't get sloppy now towards the end and kind of give up. So, and precisely because at this time, there's so much positivity in the community. There's so many people out there who are not wearing the masks, and they are asymptomatic and they're spreading it. So the second issue is the one that we don't know. And then you say, well, how can we be getting the vaccine and then have to be worrying about this? We don't know how long those antibodies are going to be good for. Now, I expect that everybody who gets the vaccine after they got their second dose, they're all going to feel pretty comfortable, because most SARS and most flu last at least a year. So we're going to feel pretty comfortable. But until things start getting better and we actually reach herd immunity, it would be real smart to still be careful, still wear your mask in public, and, don't be that brave all of a sudden.
Understood. And let's see, the last question, and you didn't really mention this in your presentation. There's been some discussion of a second and third strain of this virus. And if I understand, and I'll be careful with my words, if I understand correctly, they're saying it can be dealt with the same dose or vaccine that's currently available, but these second and third strains, they just spread a little faster. Is that what I'm hearing? And how much of an impact is that going to have on us?
Yeah, you're absolutely correct. These second and third strains, by the way, they are here. We definitely have the first strain that came out. We have had 3 cases of it here. They are more easily spread. They're more contagious, but they're not making people any sicker, and they're definitely not causing people to die. None of the people that have had it have actually passed away. So that is good. So it's possible that that even though it's mutating, because all viruses mutate, that's why it's hard to make vaccines for viruses, is that it may be getting a little weaker in the sense that it's not as deadly. However, the beautiful thing about the messenger RNA methodology of this vaccine is that it won't matter. The very reason they decided to go in 1918, there's a whole article that was published talking why they wanted to go towards messenger RNAs, precisely because that messenger RNA is going to have your body making antibodies against the spike where the protein is, those little spikes, the corona, the little crowns around it, those little sticks that are sticking up, that's what it's going to make antibodies against. And it doesn't matter that the virus itself mutates, those protein spikes do not mutate. They stay the same. So the virus will, the vaccine will work on all the mutations. So that's the exact reason why this messenger RNA new way of making vaccine is so exciting and so revolutionary.
Right. And again, I guess that kind of, reinforces what we just talked about as far as maintaining the diligence as we did 6 months ago or 8 months ago. Thank you, Dr. Alonso. I appreciate your time very much.
I'm glad to do it.
Commissioner Robinson, I saw your light on before, but
Yeah, I did. Thank you, Doctor, for the time and communication. It's important. We're all, this has been a test of everybody's patience. Am I to understand that what percentage of vaccines are you responsible for distributing? How many other agencies are there, and will we be able to communicate to those people or?
Yes, you're going to communicate directly with me. I'm giving the vaccine out for the community. The other two distributions, one is from the governor, like he's the one that chose Kings Point and Century Village, and he's the one choosing some of these churches. Those are state-run operations. I don't have anything to do with that. I don't have anything to do with the vaccine that comes from it or to it. The hospitals are getting their delivery right from the feds, right to the hospitals. And the long-term care facilities are getting it through ACA, which essentially is going through the state. And the only distribution that I have is for the community, for the 65 and older, for fire rescue, and for the healthcare workers. So those three groups that are in the governor's orders is for that last group. It's for the community groups. The hospitals and the long-term care facilities are out of my distribution.
So what sort of percentage is that you have control over?
Probably a 33%.
Okay, thank you. Thank you for your time tonight.
It's very welcome. No problem. Glad to do it.
thank you. Commissioner Bloxham?
First of all, I want to thank you for your presentation. It was very informative. I just have a question. When you spoke before to the county, you talked about the phases. And you said in phase 3, we probably will not get there until early spring or summer. And that's going to be more for the general population. Could you explain that a little bit more so that our residents will know exactly when people under 65 may be able to get the virus? My second question is, do you think that the governor will change and make another executive order and talk about people with comorbidities? You know, he seems to have left them out in his thoughts about who he wanted vaccinated first. And I think that there may be a person under age 65 who is far more vulnerable than someone who is over 65. You know, so I want to know, can we speak to that? And then what can we do as a city to help you? You know, you're working really hard. And if there's something that we all can do, we certainly will try and make it happen. So I have 3 questions. Thank you.
Okay. Fantastic. Is it possible for me to share my screen?
I believe so.
She
Okay.
wants to share her screen.
Can she share her screen?
I'm going to try to do that.
Keith is listening.
I have a little button here that says share. I'm going to try it. Yep, there it is. Okay. Let me show you. Can you see this?
Yes.
Mm-hmm.
Okay, these are the 3 phases. Let's see if I can put it so that it goes bigger. There it is. Can you see that pretty good?
Yeah, that's perfect. Thank
Yes.
you.
Okay, those are the 3 phases of any vaccine. Okay, this is not specific to COVID. This is any vaccine. Phase 1 right here is limited vaccine. That usually lasts for 2 months. We started in late December. So I don't expect to get out of phase 1 until February, maybe March. At this time, there are those closed pods. We might have some mobile sites out, like for fire rescue. And the state has designated priorities. In our case, originally it was fire rescue, paramedics, and EMTs that were going to vaccinate. And first responders, they knocked out the police department completely out of that to make room for the 65s and older. And then, of course, they left healthcare workers in direct contact. They did not put the recommendations from the CDC that would have been to start with 85 and older and or people with comorbidities. That was taken out. So that's the reason. And I agree 100% that it's not the age that matters, is how vulnerable is the person. I am vaccinating a woman in front of me that is 65 years old. She does aerobics 3 times a week in the pool. She plays tennis and golf, I don't know how many times. She could kick my butt any day of the week in terms of health. She is very healthy. And another person next to her is 95 with, cancer and all kinds of comorbidities. It completely 2 different individuals. So it's not the age, it's how vulnerable, how many comorbidities does the person have in terms of the possibility of COVID really affecting that person. So the fact that we picked 65 in this phase 1 was not, in my professional opinion, not well thought out. I think it was thought out in like, yes, the 65 definitely deserve our attention, but it was not thought out in terms of the supply and demand piece, okay? So this is going to take, again, till February, March. This second phase is when there's moderate vaccine availability. That's probably when we'll be able to release some more vaccine. We then expand the population categories, and then that's when we expect then the governor to come in and say, okay, maybe now he'll do the people with comorbidities that would add here. And now you start having closed and open pods and mobile sites, and you start moving your vaccine a little bit greater. And then finally, in early April into the summer is when you have sufficient vaccine to do your general population. You have open and closed pods, you have mobile units, you have mass vaccination centers. This is when you can really rev up and start handling all your urgent centers, your pharmacies, and really maximize the whole network that you've put together in these first 2 phases. And then the other question you asked had to do with, remind me again, the second part.
Commissioner Bloxham, you second.
What my second question is, one of the things is what we can do as a city to help you, you know,
Yes.
and then do you think that the governor will expand his executive order, to include comorbidities?
So the place where you would expand would be here in phase 2 and in phase 3, right? That's where you do your expansion once you get to here. So what the communities can do is get ready, knowing that these phases are going to happen. Get ready so that you can mobilize. When I say we got enough vaccine and we can start doing some mobile units or some mobile sites at churches, at recreational centers, at things like this, that you have everything in place. You know how to make the appointments, you know how to set it up, you know what you need to do in terms of getting people there, and then we can help bring vaccinators, like whether it's the fire rescue, the EMTs and the paramedics that can do that, or volunteers from the community, or other individuals to come help us to do the actual vaccination. And you can be ready then to set that up. So that's what you can organize as a community. There may be retired nurses. We're getting a lot of retired nurses that are helping us to vaccinate. You can get doctors and so forth that can help you do that vaccinating.
Thank you.
Thank you very much.
Thank you.
And talk to fire rescue. They have it down to a science in terms of the distancing for your chairs and all that kind of stuff. So talk to fire rescue. They're very, very capable and very knowledgeable. They can give you a lot of information of how to actually do it.
Yeah, no, we've worked with them well together. In fact, I would like to say on behalf of the city of Lake Worth Beach, we're ready.
Okay.
We're ready.
All right.
We've been working these last few weeks, getting everything together, and we're ready. We're waiting for that vaccine to come in. Thank you so very much.
I'll be calling on you as soon as I get that vaccine. I'll be calling because Lake Worth,
All right.
I want to hit that hard because we've got a large group there that needs vaccinating.
Yes, we do, and we're so
And in
very
the
grateful.
meantime, another thing you can do is get that word out to those community people because it'll do us no good to vaccinate, be ready to vaccinate, and then nobody wants the vaccine. One of the problems in the nursing homes is that because they have such a large foreign and Black workforce, hardly anybody in the long-term care facilities is taking the vaccine.
Wow.
So that's a really horrible thing for here. The 65s are, they're really going to be impacted by these community, their healthcare workers not taking the vaccine.
No, people are tracking us down every day on daily, so they're ready. Oh, Dr. Alonso, thank you so very much. We know you've got a heck of a job before you and over these last few months as well. We're very grateful. And thank you so much for being here with us tonight. City Manager, did you have something?
No, you covered it, Madam Mayor. I always appreciate Dr. Alonso, all your information, the work you do for the citizens. So look forward to continue our good working relationship. Thank you.
Well, I love you all. Thank you. And
Love you
I'm
too.
here to help you. As soon as I get that vaccine, believe me, I'll be calling on you.
Thank you.
All right.
Good night.
Good night. Have a good
Good
meeting.
Thank you. I would like to take just a quick second to ask my fellow commissioners, could we move the proclamation for Mac McKinnon up just because I know there are family members
Yes.
on the call and I just would like to, do we need to vote on that, Madam Clerk?
No, Madam Mayor, I think we're good.
We're good. Okay, thank you. Then we'll make that item next. Thank you.
Good.
Want to make sure she's.
Yeah, are they
Keith,
there?
can you ask the McKinnons to come back into the meeting, Keith?
Yes, I am doing it now. I've got two.
I see Kathy there.
How about Dana Torres?
No, Nancy, Kathy, and I don't know whether Tom is here.
That's all I have.
Okay. Kathy, as long as Kathy and Nancy are here, that's good.
Okay.
Yes. Can you hear me? This is Nancy.
Yes, we can. Thank
Okay,
you.
great.
Hi, Nancy. Thank you so much for being
Hi.
with us. Hi.
Thank you.
It is such with a heavy heart that we do this, but with sincere love for your family and the legacy that both your dad and your mom. I know this proclamation was put together before the passing of your mom as well. And so everyone just know that we are thinking about you. We have been thinking about you, and the legacy here in the city is so very strong. And let me tell you something. Everyone knew your dad for having probably one of the biggest hearts.
Yeah.
And a good sense of humor too.
Yes, thank you.
And he was always a motivator too for me. He always had such a kind word to say. So this proclamation is for him.
Thank you.
Whereas C.H. Mac McKinnon, former commissioner for District 2 in the city of Lake Worth Beach, passed away after contracting COVID-19 while visiting family. And whereas Mr. McKinnon was a prominent figure at Lake Worth Community High School, where he served for many years in various capacities, the school's football field was named in his honor. Whereas Mr. McKinnon has served in the U.S. Navy during World War II and earned both his bachelor's and master's degrees from the University of Florida, having moved to Lake Worth in 1963. And whereas Mr. McKinnon, after retiring from Lake Worth Community High School, decided to go into politics in Lake Worth, where he was elected to the District 2 Commission seat in a runoff election in 1998, and where he served for 7 years. And whereas all indications are that the greatest achievements and joy of Mr. McKinnon's life were his wife, 71 years, Mary Jane McKinnon, and his children, 8 grandchildren, and 3 great-grandchildren. And whereas, while we mourn the passing of our former colleague and wife and send sympathy to his family, we are so thankful for his remarkable life and honored to have had as a city commissioner with such a long record of exemplary public service. Now therefore, I, Pam Triolo, Mayor of the City of Lake Worth Beach, Florida, by virtue of the authority vested in me, do hereby recognize the life and work of C.H. Mack McKinnon. May he rest, may they rest in peace. I don't know if you guys, did you want to say anything? I don't know.
Yes, I'd love to choke up a little bit here. That was lovely. Thank you.
Oh, you're so-
Just thank you so much for including us this evening. But our dad was just very proud and humbled to be able to serve the wonderful people of his community. And he and my mom both absolutely loved Lake Worth, loved Lake Worth High School Trojans and Lake Worth, the concern for Lake Worth Beach. I mean, like you said, we've been there since the early 60s, and all four of us went to elementary and Lake Worth Junior and our beloved Trojans. And so Lake Worth is very much a part of who they were. And he would have been very honored and very grateful for receiving this evening. And if you know Mac, kind of like me, he would have been very choked up and just, very appreciative. And he just had the biggest heart and such integrity and just a love for mankind. So thank you. They're going to be missed.
Oh, big time. Big time, big time. Thank you so very much. And our hearts and thoughts and prayers are with you always. And we're always here for you guys. You are you are a part of us. We're family.
Thanks for sharing him.
Thanks for sharing. Exactly. Perfect.
Yeah, he's a great guy and she's a great woman to share. So we all were blessed by their presence for sure.
I know. I wish it would have more years. Thank you so much, guys.
Thank
Like
you.
I said, if you need anything, you call us.
Thank you.
All right. He was a crier too.
I know.
Like me. All right. Okay. We'll move on to our presentation. This was item B, the 2021 legislative agenda presented by Richard Pinsky. Where has he been hiding?
That's all right.
Deb.
Where is Richard?
Keith, can you bring Richard in?
He was in the waiting room.
What was that, Deb?
Can you bring Richard Pinsky over?
I sure can. Working on it right now.
It's so funny to talk about virtual waiting rooms.
There he is. Richard, you're
Okay,
muted.
hello to everybody.
Hello there, Richard. How are you? Happy New Year.
Oh, to you too. That is a great screen background you have. It actually looks like you're in the council chambers.
We are.
Oh, okay, good.
Thanks, Ron.
Where are you?
I am in my home at 356 Valley Forge Road.
Okay, thank you.
Okay, so Madam Clerk, how are we doing the screen? Are we? You have the presentation, correct? Okay,
Keith
good.
has it
Perfect.
right there for you.
Okay, good.
Thanks, Keith.
Okay, Keith, let's go to the next slide. Perfect. Okay, so so this is the Palm Beach County Legislative Delegation. David Silvers, Representative Silvers, is the new chair. Mike Caruso, who actually represents the eastern sections of Lake Worth Beach, is the vice chair. And then Senator Berman, of course, is still our senator. Tina Polsky is not a new member of the delegation, but she is new to the Senate. Representative Omari Hardy also represents sort of the central spine of Lake Worth Beach, and he is a new lawmaker. And then Joe Casello has a little piece of towards the south of Lake Worth Beach, and Kelly Skidmore is a new state representative, a returning member. She used to be in the legislature. John Snyder. Some of you that are veterans of the process may remember Representative Will Snyder from up in Martin County, who's now the sheriff up there. This is his son, John. Emily's returning, Matt Wilhite's returning, and Rick Roth is returning. Next slide, please. These are the upcoming dates. I was in Tallahassee last week, and the access to the building is limited. Really not on the Senate side at all. You are able to access the House office building and parts of the Capitol. I will be back up there next week for the second interim set of committee meetings, some interesting pieces of legislation coming up. And then in rapid succession, we have 3 more committee weeks, rounding out all 5 committee weeks by the 3rd week in February. We're off for a week. Also in February, the governor will be issuing his budget recommendations. And then, of course, it comes a little early this year, but session starts March 2nd and actually ends April 30th if we end on time, which we should. Don't know when Palm Beach County Days will be, if there's going to be such a thing as Palm Beach County Day, and don't know what the league and what some other folks are planning. It depends, I suppose, how the pandemic rolls out, whether things are relaxed and people are comfortable entering the Capitol and having larger group meetings. Right now, the prospects are slim at best. The next slides, please. So the issues, by the way, it's going to be all COVID, all day, all session. That's all that's really going to be dictating it. But by the way, the governor did announce today, I think it was Commissioner Amoroso asked Dr. Alonso the question about tourism. I think could have been Commissioner Maxwell, I can't remember. But the governor announced today that he is going to ask for guidelines, which are being worked on now, about vaccine tourism, and obviously trying to limit it, curtail it, or at least have some guidelines governing people that are either down here for the winter or coming here for the purpose of getting a vaccine. But the session is going to be dominated. There are already a number of bills that are dealing with unemployment as a result of the pandemic, the vaccination distribution. There are conversations taking place about changing the protocols. Liability is a big issue. We heard a bill last week about the liability of schools, local governments, businesses, et cetera. And then, of course, hospitals is the big one. The perennial home rule versus state preemption will be there. Vacation rental bill has been filed. That's coming back just when you thought we were done with vacation rentals. And then the other preemption bills are the recyclable materials. The tree pruning bill has been filed again. And then we heard from Dave Ehrenberg 2 weeks ago at the legislative delegation meeting at the county convention center, and he has outlined some holes, some glitches that have to get done on the sober home regulations. Next slide, please. Water is the other major issue. Not quite sure how funding is going to take place, but water is going to be a big focus of lawmakers, which has already started. Septic conversions, flood mitigation, sea level rise. We do have the rules for Senate Bill 712, which passed last session, that are going to be coming out in March. You may recall that bill sets new guidelines for what communities like Lake Worth Beach can let their outfalls contain nutrient levels are going to be greatly restricted. So any storm water going into the intercoastal waterway, the C51, any of the water bodies that will get into the larger water bodies, any canals, those are all going to be dealt with as in the rulemaking. The legislature will get another look at the rules before letting them go forward. So they basically get another bite of the apple. Reclaimed water is going to be a part of the rule, making water reuse, and basically just overall communities that have flood issues that, for instance, like in our golf course area, once that floods and the water recedes, it may not even be stormwater or a runoff. What are we actually putting back into the intercoastal waterway that was sprayed on the golf course, for example? So those are going to be much stricter regulations. And we heard from the DEP secretary last week that he expects that first set of draft rules to be released first part of March. So that will be a big part of the session as well. I did mention water reuse, reclaim water. They really have not done much as far as the guidelines, but there is some legislation. Representative Maggard, he introduced the bill last year. He's got it again this year. He's very focused on water reuse. Of course, the state budget is going to be the elephant in the room. We already know from estimates from last week, we're going to have a 2.75 billion with a B deficit in the coming fiscal year. And there are so many projects, and there was so much, not just for member projects and communities, but there was a great deal of just budget items that were vetoed by the governor. He waited all the way till July 1st, like literally the 11th hour before the budget went into effect, before he issued his vetoes, waiting to see if any forecasting from the pandemic would change. So he, hindsight, you could say he was correct in trimming projects and cutting a lot out of the budget from last year. However, that is nowhere near what's going to be needed going forward, because everything, as I mentioned, with the pandemic, so you've got healthcare costs that are going to be more impactful than if there were no pandemic. So just typically in the area of Medicaid or indigent healthcare, we have a $1.2 billion shortfall of that 2.75 that has to get made up. So you have to start thinking about, oh my God, where are they going to be finding revenue to reach that? One would be online sales tax. There was a bill introduced, in fact, today. They call the Wayfair bill after the online retailer. And that would be taxing online sales. The Republican legislature has been tax averse. However, their justification for taxing online sales is that it actually is hurting local merchants that do have to collect and remit sales tax, whereas folks are able to go online, buy similar or the same products and not pay the tax. So the Republicans are portraying this as a tax equity, but it will capture about $700 million of that $2.7 billion shortfall. There is some talk about fixing the gaming compact, which could perhaps produce another 500 million, but it is going to be very interesting how the commitment for water projects, getting things done, and just funding just the infrastructure in the state of Florida that is so needed and really in such disrepair that while you're facing such a budget shortfall, there has been no talk of bonding, and there's been no talk of going into the rainy day fund. But of course, we haven't started session yet. Next slide. So of our local project funding, we, along with your staff, we have identified two of the most serious projects needing attention. The challenge in requesting local project dollars this year is frustrated by a new guideline and rule that the House has adopted for funding projects. So in the past, you may have a $5 million project that you would want to get done. And neither of these projects don't don't freak out. None of these projects reach that level, but there could be projects that are worth $2, $3, $4, $5 million. So local governments have been asking for funding for help, whether it's a septic project, a flooding project, a stormwater project. And then when the pie is cut up, typically the community will be asked, well, you're not going to get the $2.5 million you requested, but will you take $250,000? And of course, the local community always says yes. We, for example, on Boutwell Road, we had asked for more. We didn't get everything we asked for, but we took what they gave us and said, thank you very much. And it really did help bridge the gap and got the project done. This time, none of that will be done that way. The House is holding local projects to a serious 50% match. And so rather than asking somebody if they're shovel ready, of course it's shovel ready if you have 50% of the match ready to go. So they're looking for shovel ready projects and that you have, meaning the local community, 50% of the total project cost in the bank. Now they're not going to be looking at your bank account, but somebody like Michael Bornstein is going to have to, he's trying to find actually Brian Shields, someone else to sign it, but he has to sign an affidavit saying, yes, we have 50% of the project funding. And that attestation form has got to be signed, notarized, submitted before the project can move forward. So we're in the process right now of submitting South Palm Park. And that is a flooding, an area of flooding. It's one of our more serious areas of the city, and that will, of course, will mitigate the sea level rise. That's such a big cause of it. The same thing at the south end in Eden Place neighborhood, the sea level rise mitigation.
North
So just the opposite. I'm sorry, South Palm Park, and then further north Eden Place. And so the combined of those two projects are $1.1 million. So we will have to attest, and it will probably be Michael Bornstein, will have to attest that there's $550,000 should the legislature give us any portion up to $550,000. We have that money ready to go and we'll use it in the next fiscal year. We've discussed more projects, but knowing that the council is going to have to verify and possibly even vote to make sure those funds are segregated for those projects. But if we're going to put in for these projects, and we're about to, we have to make sure that we have the money to match. Next slide. And then, of course, I have been in conversations with Representative Crusoe, Senator Berman. There is still our priority of the Ocean Current Energy Initiative. There still remains only one place on the face of the earth where if ocean current energy was going to be generated and successful, it would be the Gulf Stream right off the coast of Lake Worth Beach. A new development occurred over the holidays, right before the holidays, which we're very excited about. As you know, we've been partnering with SNMREC, the Southeast National Marine Renewable Energy Center, which is located at Florida Atlantic University. But up until now, Florida Atlantic University, while SNMREC is housed on campus, it has not been necessarily part of the funding initiative request that the university goes through every year. We were informed prior to the holidays that this year is going to be different at both the state and federal level, that the administration at FAU has decided to make ocean current energy its top priority for funding requests, both at the federal level as well as the state level. So they've made a decision to embrace ocean current energy like they've never done before. We think the prospect of fruition and getting something meaningful as far as funding from that is exponentially greater than it's ever been in the past. This week, matter of fact, I think it's tomorrow, we're having one more sort of strategy call with FAU and of course SNMREC, and then Michael Manager Bornstein's been taking the lead and will be on the call as well, and basically to finalize just what that ask is going to be. We're all holding out hope and no reason not to, that we believe good things will be coming out of the Biden administration for things like an ocean current energy initiative. So all hope springs eternal, I understand, but this collaboration that we now have, I think, is actually going to produce something in the coming months. Representative Crusoe's ready, Senator Berman's ready, Nikki Fried, Commissioner of Agriculture, is ready. So I think the planets are in line. Next slide, please. So to recap, our Lake Worth Beach legislative agenda is we're going to, of course, lead with our sea level rise and stormwater outfall mitigation projects. But of course, we're going to do everything we can to support FAU, because that's sort of the tentative role that we're going to be taking. So instead of asking FAU to support us, I think this is going to be more of us supporting FAU. Like I said, tomorrow, it's a little premature, but we will be crafting what that actual dollar amount ask is. And this project won't be in need of a 50% match, since it will be going through the university. And I believe, next slide, we're ready for questions and comments. And I'll turn it back to you, Mayor, if you want to play MC and quarterback on the questions.
Thank you, Richard, for your presentation. As you noted, the COVID issue is going to be a #1 priority in Tallahassee. Can you speak to what type of legislation, if any type of funding relief for renters and mortgages and things like that, people that have been really socked in the pocketbook? Is there anything, any long-term relief discussions?
Yes, I will try to. There's so far, there's a number of ideas that are being floated. One is I hate to say it, but a preemption, which would freeze evictions and or at least extend the time that communities can have to work through. They are talking about some tax breaks on affordable housing that residents have suffered. So I would imagine through the Florida Housing Finance Corp, perhaps, maybe even in the tax bill. But there are some affordable housing tax issues that are just being rumored. I mean, I follow it, but there's been no proposal other than on the evictions and relief for Medicaid patients, but nothing specific for communities that have indigent communities or that have workforce housing. Any of that would come through the Florida Housing Finance Corp. But we will definitely see housing tax relief, particularly in the area of evictions.
The other question is, a couple of the priorities were vacation rentals and sober homes. Can you speak briefly as to what the key components of those two pieces of legislation might be?
The sober home, and I would have to get you because the bill hasn't been filed yet, but the way that Dave Ehrenberg presented it was, there are a couple of examples of glitches that what he deemed is basically loopholes. So I don't want to try to paraphrase without actually seeing it in front of me, but it's not overreaching policy changes. This is more or less to close loopholes that communities are experiencing. So it's to make sure that well, at the same time, you cannot regulate a home that you don't have enough fire extinguishers and hold it to a standard, but it also goes the other way, and that's what Ehrenberg was talking about, that it is to close those loopholes that folks were getting around. It seemed to be of not falling under the regulations. But I will find out and keep you posted on it. The vacation rental is going to be taking the form of another preemption, and making sure that, and I think it is somewhat pandemic related, but I believe it is once again going to try to go to the next level, that communities will not be able to and I don't know everything the community is doing, but I do know that communities have passed ordinances trying to restrict where and who, whether it's short-term, that can use their home as a vacation rental, and that's what the bill is going to be attempting to do, which is to foreclose on communities being able to do that.
All right, thank you.
Vice Mayor?
Hi, Richard. We missed your face.
Not really.
A few
Not the rest of me, just my face.
Just your face. So Commissioner Maxwell asked in reference to some of the funding around COVID, will all that be coming through Palm Beach County into the smaller cities, or should the smaller cities be stepping up and asking for some direct funding?
Great question. I have to be honest, I don't see any funding at the state level going to communities. The issues that I outlined earlier are state impacts. Medicaid, almost a $1.3 billion hit. The funding has got to go to that. So there may be the safety net hospitals that are obviously going to experience some of that shortfall, and so therefore they're the ones that are going to be compensated. If there are distribution issues, whether that includes the National Guard, I mean, the state has its own price tag of whether you like the way the state is doing it or you don't like the way the state is doing it. They still have a price tag and a cost of doing that pandemic business. The feds, however, is what I understand where the local community relief is going to be coming. Now, there could be some things that are pass through. So if a community does need help for vaccine distribution, I could see the Department of Health, I could see some of that money, but it won't be here, Lake Worth Beach, for all of the effort and everything you're taking hit. It would come through an entity that is already doing a function. So whether it's vaccine distribution, I mean, Lake Worth Beach would not get some of that money to distribute vaccines. You would get the vaccine perhaps. So those issues that I outlined are just the cost, the impact to the state. The feds, however, I understand, are going to be almost the $2 trillion package of relief that will get down to the communities.
Okay, and then in talking to the reps, we know that the speaker, and you had alluded to it, isn't going to look at anything if there's not a 50% match. For the record, last year I asked for it. I'm still going to ask for it again this year. I still think that we should take $1 million from our penny sales tax and put it towards our parks and recreations for the city of Lake Worth Beach. Last year, we had about $2 million in ask. So if we would take $1 million, we would ask for $1 million. I think that we've done some of the CDGB funds and some of the other work. So I don't know that our ask would be as much, but I feel, you know, at this time in the next phase of COVID, our children need to be out in our parks, in our recreation. And, you know, I just want to go on the record that, you know, once again, I'm asking it this year. I was shot down last year and, you know, I don't expect it to go anywhere, but for the record, thank you, Richard.
Thank you.
I want to comment, but I would say this, there's no doubt tracking, you know, watching the way they've been doing this for the past couple of years where they actually file a bill in the House. By this time last year, we probably had 3 or 4 times the amount of bills filed on funding requests. I was just looking through, it was probably maybe 75, 80, maybe 100 by today that have come through. But if this was last year, you know, 4 weeks before session, we'd be at 400 asks in already. There's almost 1,000 requests last year. So there's no doubt that the 50% match attestation is going to be a little bit of a governor on the pedal of the funding machine. So if you have, whether you can get your colleagues and whether Lake Worth Beach wants to put something towards parks, just the fact that a community is putting up 50%. So right away, you know, there's going to be projects that are going to be closer to the 500,000, 1 million, 2 million. I don't think we're going to see many projects from a community like we did last year that are $5 and $10 million, because who's got $5 million match? But they were just hoping, you know, ask for the moon and maybe you'll get a piece of the earth. So the fact that the community, in this case, Lake Worth Beach, is going to put up some money, you know, right away you're in the running. So if they have a finite amount of funds, obviously, you know, the limited number of projects are the ones that have the 50% match are obviously going to be in much better shape. So if you have the money, you have a much better chance of getting something.
Thank you.
City Manager.
Yes, Madam Mayor, just a couple of things. On the Ocean Current Energy side of the house, and you're very familiar, Mayor, having visited with a lot of the different parties, both at the state and the federal level, as well as FAU. I think we finally gotten a recognition that the university can actually compete effectively in the energy bandwidth, which is different for a university. They're used to competing with other universities for education dollars and those kinds of things. So, and this is something I want to, you know, Richard brought up some time ago, and in the meetings that we've had with the president of the university and the different folks, and also the other meetings when we were in Washington. I know Vice Mayor Pro Tem, we spent a lot of time, effort, and energy focusing on, you know, getting people to understand what this project is and where we're going with it. Now to have FAU raise it to the level, it makes us very hopeful. So from the meeting that we have tomorrow, in some of the more of the coordination and with Richard's guidance and Gabe, I'll say this as well, we'll report back on where we are, and we're just very optimistic that we'll get some money. Also coupled with the change of direction that may be occurring, as we believe in Washington, with the Biden administration's focus on different forms of energy. Here we are, folks. We can do this. The other thing is, and I say this every year, having worked in local government and been in Tallahassee for God knows how many years, success in the legislature isn't so much about good legislation being passed. It's about killing the really crappy stuff. And there's a lot of that usually. I know that we're monitoring. I just sent a bill to Richard today on the utility side of the house that would have negative impacts. So remember, it's not just about in this game, that ideal getting passed or that thing getting funded. Those are very important, don't get me wrong. But it seems like everyone else in the state's trying to gore your ox, as we would say. And we need to be careful and diligent on those things. And Richard's very plugged in. We're plugged in with our associations that we belong to, the League of Cities, the Florida Municipal Electric Association. We have a lot of advocacy as municipalities. So I encourage y'all to talk to your various organizations that you belong to and look for bills that would do us harm. And we need to be as much aware of those as we are the good stuff we want to see passed. I just wanted to remind you all that. Thank you, Madam Mayor.
Sure. Question for you. When we talked about last time about the Osborne Center
Mhm.
and, for the children and Wembley, the gym, we talked about creating and enhancing those facilities. Are those the types of projects that we can apply for financing for with a match?
Well, and to Richard's point, he kind of danced around the shovel-ready aspect.
Okay.
You need to really have plans you can execute, because when the governor signs, if it passes, you need to be off to the races. That means you've done most of your, at least conceptual soft cost and design costs to give you what it will cost. And then the match, you need to find that in your budget. And that's something we need to, it didn't happen in this budget cycle because of a lot of reasons, and it's going to be a tough budget discussion you're going to be having going forward. And I know that there's interest in talking about some of the prioritizations of the remaining money, which at this point is basically the $6 million sales tax conversation we've sort of talked about individually.
Okay. In addition to that, Richard,
Did that answer your question, Mayor?
yeah, I know, Chair.
We got to do the detailed work first.
All right, let's get on that. Yesterday. So, Richard, as for our representatives of our city, have they assigned committees yet?
Yes, they have. I could have gone through it now. I did distribute that. They have all been signed committees, and the first round of committee meetings happened last week. And next week they'll have another round of committee meetings. And unlike last session, all of our delegation were actually in attendance and in their chairs and attending the meeting.
When I said the committee, like, is it in the backup, the committees that they're assigned to?
We had a,
He had his email that,
Email?
yeah, we'll resend it.
Okay, thank you. I'm sorry, I didn't see that.
Yes, ma'am.
No, I just didn't know, are any of them?
Was there someone in particular that you cared about? I
No,
know
I
you
just-
care about all of them, but.
No, I just wanted to know if any of them were on committees that are beneficial to our asks.
Mike Caruso, most definitely.
Okay,
And I don't want to take anything away from Joe Casello or Amari Hardy. So is Lori. Lori's on community affairs. And so that's the first committee of any substance for our local issues. But they are, one's a freshman, also not in the prevailing party. And so our delegation, while they are well-liked, Joe Casello is well-liked, and we've got folks, Lori Berman. We're not suffering from what we have in the past about having a lawmaker, let's say, that is not liked, doesn't play well in the sandbox with others. All of our folks are good. They just don't happen to be in positions of leadership other than Mike Caruso. Our delegation lost a little bit when we lost Marilyn Magar. Gail Harrell, she's a senior member, but she's from up in Martin County more than she is Palm Beach County. But Mike Caruso is on a couple of very key committees. He's also, well thought of amongst the Republicans, vice chair of the delegation. And I spoke with him last week. He's like, I want to lead the charge on ocean current energy. I said, Mike, don't worry, there's no one else we're going to. So, but I would say he is, and he's sponsoring our funding request for South Palm and Eden. So the others will come along. They'll eventually mature and move up the ladder. But right now, Mike Caruso is probably our best, most influential.
okay, thank you. Commissioner Robinson?
past decisions or consequences, the 1.2 billion shortfall can we attribute any of that to our Governor Scott decisions?
No, we were, when DeSantis came in, he took a tremendous leap, and we went from a little over $90 billion budget to almost a $93 billion. I mean, I could not believe we put a $2 billion increase. And then so this past session, it got scaled way back. We lost almost 2 billion. And then, so this is really, but for the pandemic, I think we'd be seeing a budget increase and things were humming along as far as the Florida economy. Tourism has been a major impact of the shortfall. And then coupled with the cost of the pandemic and the fact that you were talking about the comorbidity earlier. I mean, the indigent healthcare costs have been through the roof. So we've added something like, I don't know what it is. I want to say 40,000 people to the Medicaid rolls, or probably more than that. It's probably 50 or 60,000. But it is the cost of the pandemic and the pressure it's put on schools. I mean, everybody's just had to spend more money on everything. And that is really that's really the cause, plus the lack of revenue, and those two things combining. So this was really, as much as I wouldn't mind putting the at the fault of Rick Scott, I really, good conscience can't.
Is insurance issues going to be talked about at all in Tallahassee? I mean, in terms of sea level rise, in terms of flooding, in terms of health insurance, is there any conversation about regulating insurance to the benefit of something other than insurance companies?
Well, for prescriptions, yes. I mean, there is continually efforts to drive the cost and prescription benefit managers and just really what is driving that healthcare cost and the cost of medical insurance for prescriptions. But really, the big issue for insurance is the liability of the COVID-19 protocols. So, if a restaurant, I heard Dr. Alonso reference a local restaurant where the tables are right next to each other, and you show up, and then you can contact trace it to that restaurant. Is that restaurant liable? Did that restaurant do a good enough job in making sure that people were wearing masks, were screened? And so the business community wants to have that issue of liability insurance, as well as hospitals. You go in, I mean, there's any number of issues, including schools, that the liability issue of insurance in relation to the pandemic and who's at fault and how much they are at fault will be the number one insurance issue.
Mr. Robinson.
That's it. Thank you, Richard. I wish you had some money to hand out in Tallahassee, and then we might get something done.
Thank you, Richard.
Thanks, Richard.
Thank you very much.
Okay, guys, let's just take a 5-minute break and then we'll continue because we've got a big presentation.
Keith, it looks like we're just missing Commissioner Maxwell and Michael.
Okay, I took down the sign and we're ready to start whenever they want to go.
Okay, I see Commissioner Maxwell walking back in, so we're good to go. Why don't
So on that note, we did get an email. One of our public comments wasn't able to stay on due
Yeah,
to.
I already wrote back to them. That's fine. I asked them to join us on February 2nd.
Okay,
So we're good with that one. I don't see Michael, but I think we should get started. Are you going to put us back on? Keith?
oh yeah, we're always live. We never go off live.
Okay. Madam Mayor, it is 7:53 and we are back live.
Thank you very much. We'll resume this Tuesday, January 19th, regular city commission meeting. Moving on to our presentations. Item C, FDOT presentation about 10th Avenue North and the I-95 interchange. Who do we have with us from FDOT?
Good evening. My name is Humberto Arrieta. I'm the FDOT project manager.
Hello there, welcome.
I am here with Andrew Nunes. He's the consultant project manager for this project, and also my boss, Anson Sonnet. So what we'll do is I'll turn it over to Andrew Nunes, who's going to go over the presentation. This is a modified version of the presentation that we had during the alternatives workshop back in October. So after the presentation, we can take any questions.
Okay, wonderful. Thank you. Welcome, Andrew.
Hey, good afternoon, good evening, commissioners, and good evening all. Can everybody see my screen?
Yes, we can. Thank you.
It should show the City of Lake Worth Beach Commission meeting with an aerial on it.
We're good.
Okay.
Are we ready?
Yep, we're ready. Just having a little bit of a technical difficulty here. Okay, here we go. Okay, Humberto. As Humberto mentioned, my name is Andrew Nunes. I'm the consultant project manager with the with American Consulting Engineers. Thank you for the opportunity to present this project to you today. This presentation is for the I-95 at 10th Avenue North project development and environmental PD&E study. The financial project ID number is 412-733-122-02 and efficient transportation decision-making ETDM number 14337. Let's see here. The environmental review, consultation, and other actions required by applicable federal environmental laws for this project are being or have been carried out by the FDOT pursuant to 23 U.S.C. 327 and a memorandum of understanding dated December 14, 2016 and executed by the Federal Highway Administration and FDOT. Today's agenda will include an introduction, the PD&E study process, project description, key project issues, alternatives analysis, summary schedule. We have a short project animation and our closing statements. So the project location is State Road 9 I-95 interchange at 10th Avenue North. It's within Palm Beach County, within the City of Lake Worth Beach. State Road 9 I-95 is a 10-lane divided interstate facility. It's on the Strategic Intermodal System, SIS. The posted speed limit is 65 miles per hour, Adjacent interchanges are 6th Avenue South, which is 1.28 miles to the south, and Forest Hill Boulevard, which is 1.9 miles to the north. 10th Avenue North is a 4-lane divided facility west of I-95. It's a 4-lane divided east of 95 also. It's an urban minor arterial, and the posted speed limit is 40 miles an hour. The South Florida Rail Corridor, or CSX Railway, runs parallel to I-95 on the west side. What's a project development and environmental study? Well, essentially, it's a process followed by FTOT to evaluate engineering alternatives, environmental impacts, social, cultural, and economic impacts associated with a planned transportation project. It's mandated by the National Environmental Policy Act, or NEPA, and is required when federal funds are involved. The PD&E study process is the second phase in a normal 6-phase project implementation program. The PD&E study consists of data collection, preliminary concept analysis, engineering analysis and design, environmental analysis, public involvement, and final documents. Because of minimal impacts to the environment, traffic operations, and no right-of-way acquisition, this project is being reclassified as a categorical exclusion type 1. As a result, there will not be a public hearing and no need for location design concept acceptance. The project limits for the study on I-95 is from south of 10th Avenue North to north of 10th Avenue North. On 10th Avenue North is from east of North Detroit Street to North A Street. The purpose and need, the project purpose, is to improve the local and regional transportation network while also providing enhanced multimodal interrelationships at the I-95 and 10th Avenue North interchange. The project need, the primary criteria, reduce congestion and improve interchange operations and avoid any spillback onto I-95. Also want to improve the safety conditions by reducing conflicts and accommodate future traffic demand through the 2045 design year. The secondary criteria would be to improve the multimodal, pedestrian and bicycle connectivity, improve freight access and mobility, and enhance emergency evacuation. The existing crash analysis for 10th Avenue North, we looked at the 5 years of crash data from year 2014 to 2018. There were a total of 198 crashes recorded that resulted in 95 injuries and no fatalities. The prominent crash types were rear end at 51%, angle at 14.4%, and side swipe at 8.6%. The graphic above on the right here, it shows the majority of crashes were at Barnett Drive and also at the I-95 southbound ramp and at North A Street. Let's talk about level of service. What exactly is level of service? The level of service is a standard measurement based on vehicle delay and speed that reflects the relative ease of traffic flow on a scale of A to F. For example, level of service A will be free flow traffic. You know, we think that you would see that like maybe on a weekend morning or on like a Saturday morning or a Sunday morning where traffic is relative free flow. Level of service F would be highly congested traffic conditions like you probably experience on I-95 during the weekday in the evening time. This slide shows the existing year conditions. The boxes at the top show the lane configurations. The text boxes in the middle of the slide shows the delay in seconds and the level of service for the 4 study intersections. The text box in the middle on top is the AM or in the morning delay and the level of service. The text box in the middle on the bottom is the PM delay or the afternoon or evening and level of service. At Barnett Drive, the level of service in the AM is C and the PM level of service is D. At the I-95 southbound ramp, intersection level of service in the AM is C and in the PM it's also C. At the I-95 northbound intersection, the level of service in the AM is E and in the PM the level of service is D. At North A Street, the level of service in the AM is D and it's also D in the PM. This slide shows the no action 2045 year conditions. Essentially, if nothing was done to the existing conditions, what would happen to the traffic in 2045? So at Barnett Drive, you can see the level of service in the AM is F and also in the PM. At I-95 southbound ramp in the intersection, level of service is F and in the PM, the level of service is also F. And it's the same thing basically at the I-95 northbound ramp as F in the AM and F in the PM. At North A Street, the level of service in the AM is E, and in the PM, the level of service is E. This slide summarizes the analysis process for the project. The no action alternative, meaning no improvements, will be done for the project, is always a viable alternative that we carry forward throughout the process. The bill alternatives are usually long-term. They meet the purpose and need for the project. They are considered ultimate improvements, usually open to traffic within 8 to 10 years. The flow chart on the right shows a no action alternative. And also on the left, it also shows the two bill alternatives that were studied during the project. These alternatives are screened based on evaluation criteria shown in the gray box here. And they are presented at the alternatives public workshop and followed in the workshop. The preferred alternative is selected. For your knowledge, we had our alternative public workshop back in October of last year. Let's talk about the bill alternative number 1, which is the tight urban diamond interchange, which is essentially an expansion of the existing condition. So this alternative will enhance the existing configuration of the interchange. Improvements for this in the alternative include widen 10th Avenue North over I-95, as shown here, in the eastbound and westbound directions, with having an additional westbound to southbound left turn lane. We'll be widening the southbound and northbound off ramps to provide one additional left turn lane, this area here. Also, we'll be providing the improvements at the intersection of Barnett Drive are common with both the build alternatives. This alternative will include also accommodation of 7-foot wide buffered bike lanes within the interchange between Barnett Drive and A Street. This slide shows the typical sections for the bridge widenings for alternative 1. The typical section on the top shows a bridge over South Florida Rail Corridor that will be widened on the north side to provide 11-foot lanes, 7-foot buffered bike lane, and a 6-foot wide sidewalk. Typical section on the bottom shows the bridge over I-95 that will be widened on the north side to provide 2 11-foot lanes and 7-foot buffered bike lane and a 6-foot wide sidewalk. Let's look at bill alternative 2, which is the divergent diamond interchange. Bill alternative 2, the improvements for this alternative include modifying the existing diamond configuration of the interchange to what's called a divergent diamond interchange configuration. We'll be widening the northbound off-ramp to provide one additional right turn lane. At the intersection of Barnett Drive, a westbound to northbound right turn lane will be added. This alternative will include widening the bridge over I-95 and the South Florida Rail Corridor on the north side to accommodate the reconfigured interchange. In this alternative, pedestrian movements are moved to the center of the median. This alternative will also include accommodation of 7-foot wide bicycle lanes within the interchange at Barnett Drive, between Barnett Drive and North A Street. This slide shows a typical section for the bridge widening for alternative 2. The typical section on the top shows a bridge over the South Florida Rail Corridor that will be widened on the north side to provide 2 right turn lanes and also 7-foot wide buffered bike lanes and an 8-foot to 10-foot wide multi-use path. Typical section on the bottom shows the bridge over I-95 that will be reconfigured to accommodate the divergent diamond interchange and provide 7-foot buffered bike lanes and a 10-foot multi-use path along the roadway approaches where there is sufficient right-of-way. The traffic analysis for the 2045 year conditions for Bill Alternative 1 are shown on this slide. At Barnett Drive, the level of service in the morning is D, in the afternoon, and it's D in the evening also. At the I-95 southbound ramp, the intersection and level of service will be D in the AM and PM. And at the the northbound ramp intersection, level of service will be D in the AM and PM. At North A Street would also be D in the AM and PM. Looking at the divergent diamond interchange alternative 2, you can see there's a significant increase in the level of service. See at Barnett Drive, you have a level of service C in the PM and the level of service is D in the, C in the AM and level of service D in the PM. At the I-95 southbound ramp, the intersection level of service will be B in the AM and PM. And at the I-95 northbound ramp, intersection level of service will be B in the AM and PM also. At North A Street, the level of service will be D in the AM and PM. The drainage analysis for this project is required to meet the FDOT and South Florida Water Management District criteria. The drainage requirements for this project are being met within existing right-of-way by modifying the existing dry detention ponds and swales within the interchange that is conveyed to the E4 canal. Modifications to the existing collection system will be required. No additional right-of-way acquisition is proposed for ponds. This slide summarizes the environmental analysis for the bill alternatives. Social and economic resources expected to have minimal to no impacts. Cultural resources expected to have minimal to no impacts. Natural resources, expected to have minimal to no impacts. And physical resources expected to have minimal to no impacts. This slide shows the locations of existing noise barriers. As you can see, they're located on the east side of the project, basically adjacent to where all the residential properties are. Noise barriers will be further evaluated based on the proposed improvements. And this information will be further documented in the noise study report and environmental document. This slide summarizes the preliminary right-of-way impacts for each bill alternative. As you can see, for bill alternative 1, there's a total cost of approximately $30,000 for right-of-way acquisition, mostly on the east side near to A Street. And for alternative 2, the divergent diamond interchange, there's no right-of-way impacts. This looked at residential properties, business properties, and any vacant land. This slide summarizes the preliminary construction costs, engineering design, the construction, engineering, and inspection costs, and right-of-way costs. And you can see for alternative 1, it's approximately 11 million. And for alternative 2, the divergent diamond interchange is approximately 8.7 million. This slide shows the evaluation matrix that was prepared to compare the bill alternatives to the no action alternative. The major evaluation factors on the left includes engineering, the traffic operations, safety impacts, bridge widening. For environmental, it looked at contaminated sites, noise, wetland and species impacts, and cultural effects, and also identifies total project costs, which we showed you previously. Public involvement for the project. As you know, we had our agency and public kickoff meeting back in July 24, 2019. And I guess it was at the Lake Worth Beach facilities. We had some continuing coordination with Palm Beach County. We did a presentation to Palm Beach Transportation Planning Agency back in August of last year. And we held the alternative public workshop back in October of last year. We actually, when we had the public workshop, there was a virtual public open house on the website that was open to public comment between the period of October 7th to October 30th. Our ongoing activities will be, continued coordination with local communities and, upcoming activities, which is today's presentation to the City of Lake Worth Beach Commission. This summarizes the project schedule. No location design concept acceptance is anticipated for this project. The next step will be to finalize the documents, the environmental documents and engineering documents, and move forward to the actual final design for this project, which is anticipated to begin sometime maybe March, April of this year. Construction is anticipated to begin probably sometime in early 2025. With that, we thought that would be helpful to show you a short video of what the Virgin Diamond interchange would look like. And I'm going to bring that up now. Can you guys still see? No? Can you see my screen with the video?
Not yet. No, just you.
There we go.
Okay, there we go.
Right, so essentially what this is doing is showing like a bird's eye view or a drone view. We're slowly transitioning to the west end of the project at Barnett Drive. And then we'll turn around and show what it looks like going eastbound. So this essentially shows like what the lane configurations will be. The traffic that you see there is really intended to show what it would look like driving through the interchange, and not necessarily to represent what the traffic operations or level of service would be. It's just really a video to show you what a driver could expect while driving through the Virgin Diamond reconfiguration. You see the traffic moves over, the eastbound traffic moves over to the north side. That's what is the Virgin Diamond interchange does. It has a crossover section. As you can see here, the westbound traffic is at stop while the eastbound traffic is crossing over. And you see the off-ramp coming from southbound, and you can also see some interfaces with what the pedestrians are doing. The pedestrians are mostly moved towards the center or the median area that they're, and also protected by barrier wall. We know that that's essentially important, especially in this area, since I believe it's an elementary school that's located just north on Barnett Drive. So the eastbound traffic here is on the north side, and they can cross over and go left to go to northbound. And then you can see now they're crossing back over to go southbound, go to the south of the project. And then the eastbound continues on the south side. And you can see the westbound traffic is at the stop while the eastbound traffic is moving. You also see that we've shown here the bicycle lane on the outside here, and you can almost see animation of somebody using the bicycle lane on a bicycle. And this is towards North A Street at the end of the project. When this video is finished, I'm going to show you what it would look like from a pedestrian's point of view, walking through the DDI, starting from the east end and moving towards the west. So if you can still see the video, this one shows what a pedestrian would see when they're walking, starting from North A Street on the east side. We had shown this here at the public workshop, rapid flashing beacon, but this is still being worked out internally within the department to determine whether a signal can be accommodated, traffic signal in this area. So the pedestrian is crossing now into the island area, which has sufficient space in there to possibly provide some landscaping, as you can see with this green area here. And this path here would be set at a minimum of 10 foot wide through here. Once the pedestrians are moving towards where the traffic is stopped, they're going to be crossing over at the crosswalk here to move towards the median area. You probably saw that on the previous video. But you can see now that they're now in the median area. They're protected here by barrier wall. And we've done a little bit of modifications to change this area to be like about a minimum of 12 foot wide, which is more than sufficient to accommodate pedestrians and any kids that are probably utilizing their bicycles. Now you'll see them crossing over to go to the north side. The Virgin Diamond interchanges are fairly recent or new configuration here in South Florida. There's many different areas that are being proposed for the Virgin Diamond interchange. There's one going to be somewhere in Glades Road. There's one going to be at 45th Street on 95. There's one going to be at Lantana Road on 995 also. And there are many others throughout the state and also throughout the country. And that completes the video, and we can move on to any questions that you may have.
Thank you very much. Jamie, are you around?
Yes, ma'am.
Okay, now I know I've seen this because through the TPA, as I sit on the TPA board, and the discussion between the two types of roadways. Jamie, where did you get with the TAC on where 10th and...
One moment, Madam Mayor. Andrew, could you stop sharing your screen for a moment?
Absolutely.
Thank you, sir. There we go. Now I can see. So real quick, Jamie Brown, Public Works Director. I also wanted to, we didn't mention at the beginning of the presentation, but I'm looking to see if they're still on. I see David Ricks, our county engineer, is on, and Mo Al Turk was on at the beginning of the meeting. He's the director for Palm Beach County Traffic. But I wanted to make sure they were available. Yeah, I see Mo now. So yeah, they're both on as well in case we have any questions traffic-wise from the county. You know, I wanted to make sure we had this presentation. Hey, David. Because obviously this is we have two intersections coming off of our for our city off of 95, 6th and 10. So this is going to be a big impact for us, especially since the school just west of 95 right there. We're going to have a lot of pedestrians and you know, kids.
Well, that's what I wanted to ask you about. Did you guys go through the effect of, because it's not just the middle school which filters out, because the middle school filters out of Detroit and Barnett. And Barnett has the FedEx office and Barnett has the whatever. That's my morning commute, you know. It's pretty much in rush hour both ways, it's pretty much a 3 to 4 traffic light experience at any one of those intersections during those times on average. 10th is backed up, and I know that we're talking about widening and easing up that traffic, and that's the whole purpose of this. But you've got the middle school kids coming out from school on both Detroit and Barnett. Then you've got Highland Elementary on North A, where we've always had talks about other businesses opening up on 10th Avenue and whatever else. And the big thing has been the school buses, the kids walking, the this and the that. Is there any preferred method of pedestrian crossing areas? Because this is not just one school. This is rush hour. This is an industrial area, the Park of Commerce, semi-trailers. This is school kids walking. This is a 95 interchange. What are, from a safety standpoint, what are some of the safest designs, or do these both address safety in just about equivalent a way?
Yeah. So they say it was October 30th were the deadline for the municipality to submit comments to DOT, which we did do. One of the things that from a safety standpoint, we did submit one of our comments was, as Andrew had mentioned in the presentation, the rectangular rapid flashing beacons that were shown in that simulation. We had recommended that we should hopefully stick with a signal, because as you guys all know, you're all familiar with 10th Avenue. No one really stops, even if there's a red light there. People are more worried about actually getting on that on-ramp and getting onto 95. So the fact that there would just be a flashing beacon there with kids crossing, that was pretty concerning. So just from a safety standpoint, at least from our standpoint, it made more sense to have an actual signal where cars had to actually stop to make it more safe there. The other comments we had was more on the east side, down toward A Street. But that's, if we're looking at doing this DDI, from a safety standpoint, that's one of the things and one of the only things we can really look at doing to make this safer for crossing for pedestrians and bicyclists.
That was plan 1 or 2?
That was, the DDI was plan 2.
Plan 2, okay. And what is the classification? We said that this one's a C and this one's a C and this one's a D and that was a D. Well, I saw this.
That was, Madam Mayor, that was the level of service. So basically, what we shoot for is the acceptable level of service for the overall operation of the intersection is a level of service of D. So anything from between A and D will be acceptable.
Okay.
So once you get towards F, those are failing conditions.
Well, that was the only thing I wanted to ask, that only because in that second presentation, the other 3 intersections were Bs, I think, and the A Street interchange was D.
Right, and that is acceptable. If you compare the 2 alternatives between the alternative 1, which was the enhancement of the existing condition, the alternative 2 clearly operates much better within the other intersections as opposed to A Street, which it operates as the same, which is a D, which is acceptable.
And what other communities have you done? Other communities with lots of school children in the area with this diamond design?
I haven't, but as you can see when we showed you the video, it's essentially going to be similar to what it is today, but with the difference that now you're going to be crossing over within the median, and you're going to be they're going to be protected by barrier walls on both sides.
Okay, thank you.
Madam Mayor, I understand the concern with the new DDI is something new to the community, but the couple of things that to keep in mind that we're eliminating a few conflict points for the pedestrians, so they have to cross less times traffic, and also they have the protection of barrier wall as they come across and start walking on the median. It's a lot safer than the existing configuration that you have right now for this interchange. And as Andrew mentioned, we are coordinating with central office and FHWA as to the proper treatment for pedestrians for this particular interchange. So that will be hopefully soon we'll get a definite answer on that item.
Okay, good, because we can, yeah, as long as we're looking further to, just like I said, you got the real little ones at the elementary, and then you got the middle school ones that tear through those areas right after school. So, I mean, That's my biggest concern right there. Any alleviation on 10th Avenue North to get traffic moving properly is a good thing because it's stopped there. I know that, was it Joni from the city of Palm Springs, and that city has weighed in also on being concerned about it too. So I just wanted to make sure I asked those questions. Commissioner Bloxham, did you have something?
Yes, I live off of A Street. We have a very hard time getting from A Street to turn on the 10th Avenue. And it seems that in either presentation or alternative, we were going to be a D or we're going to be an E when you finish. Is that correct?
No, the either alternative is going to be a D, overall a D.
A D or E?
No, it
So
was,
it's saying that one is 40.1 a D and then 44.7 a D? Is that what we're going to end up with? Or those are existing years?
those were the existing years, but for
So after
both,
the alternative?
yeah, for both alternatives, the intersection at North A Street has an overall level of service of D.
D as in dog.
Correct.
Yeah,
So
but
A
Andrew,
through D is acceptable. Anything beyond D is not.
Well, I know, but it's acceptable. While it may be acceptable, it's really hard to get out of A Street in either direction. And I think that's the cause of so many accidents there. Is there some way we could widen it or do something to ease the traffic from A Street onto 10th?
Well, we actually did the simulation of the future traffic analysis, and what we're showing is that it's going to operate at an acceptable level. Dan, did you have something you wanted to add?
I was going to mention the D that you were referring, that's in 2045, right? The design.
Correct. Yes.
The interim years, it would be better than that, right? There was some improvement, or was it?
No, for the no action alternative, those is going to be a level of service of E. If you don't do anything at A Street, that year 2045 is going to be a level of service of E, which is worse than a D.
Correct, but with the DDI, what is it in it's the interim year, or when the opening year, it's going to be better than it would be with the no build.
That's correct.
Okay.
I guess what we're asking is there anything possible that can be done? I mean, the community has been, worried about development of buildings and businesses on that stretch of land there that would increase traffic there, because already that's a 4 to 5 traffic light backed up into the school zone on A Street in a residential neighborhood.
Is there anything we can do to get to a C?
Is there anything that we can do to get to a C on that street? Just because we've alleviated the problem, you've alleviated the problems obviously by 95, and also in the commercial sector west of there, but there still seems to be some concern, and I'm sure our constituents would say, is there a way we can get to a C level there and help make it better? And I know it's not magic and you don't have a magic wand, and you've been studying this is your job. I get it. No, we're not trying to be difficult, but it's just a troublesome area between the families, moms and dads and their kids, and these little ones walking in this area. And you got all of that traffic, and it's just, I guess we're just hoping for a little bit better if it's possible. Jamie, did you bring any of that stuff up at your meetings?
Yeah, like I said, we submitted the comments, and I guess they're, like Andrew was saying, they're still going through the process. So we have not, as of now, gotten any responses back to the comments that were submitted initially by the deadline.
Okay, so I think that would be our suggestion to FDOT, and to say that we're as concerned, if not more, at that intersection, just because we've got the smallest of smalls walking to and from school over there. And I think that the second project also, with the protected medians and protected bike lanes, is a great improvement in the second one. I'm used to looking at a lot of these technical plans from roads. But I think that if we could look into that a little bit further, I think the community would be much more supportive. Vice Mayor?
I'm sorry, my light's not working. Jamie, so I think what I'm hearing is number 2, and I like number 2 because of the barricades for the children. You know, very, very important, you know, as they cross multiple, I understand that they'll be crossing less, but you know, the barricades are huge. And then as we move forward with A Street, we know something can go on A Street in that corner. So if whatever we need to do, working with DOT to get that to at least a C, because we know once we get something on A Street, it's going to open up another whole can of worms. So as we're moving forward with this project, we're looking at 2025. We know between now and 2025, most likely something's going to, you know, come to A Street. What are we doing now? I mean, we've had conversations about A Street and, you know, cutting off a piece of that for a project. There's really no way to get on the left-hand side of A Street to turn onto 10th Avenue. You know, what are those conversations look like, and what can we be doing now to have those conversations for A Street to bring it up to a C? But we need to be talking about both sides of the street. You know, this is a bigger picture because we know something's coming into that land. We don't know what it's going to be or what may get approved, but you know, the future of that corner is something. So I think we need to be looking at, you know, all these pieces, and you know, we already have a problem getting out on A Street right now onto 10th. You know, what does that look like when you got, you know, more coming from the other end?
Thank you.
What?
Vice Mayor Pro Tem? Oh, I'm sorry. Go ahead, Jamie.
Well, I was just going to say, I know in the past when we've, you know, the county, and I see David has his hand up, they've adjusted some of the traffic timing there. So if you don't mind, I'd like to hear what our county engineer has to say about this intersection.
Sure. Thank you. I'm sorry. I don't see hands or anything like that. So David, you're muted. You're muted.
Unmuted, but we're not hearing.
Now you're unmuted and we still can't hear you.
Can you hear me? This is Mo Alturk.
We hear you, Mo.
We can hear you, Mo.
Okay, David, probably I'll do this for you. Okay, so I just was listening to the discussion about the intersection at A Street. And if I'm not mistaken, you have a single lane approach on the south leg. And I think, you know, with the parcel on the southeast corner being developed, if they can dedicate right of way and the right turn lane could be added there, that would certainly improve the operation at that intersection. However, if I were, you asked me to talk about what we are doing now to improve traffic flow through that corridor. And we are in the midst of retiming the corridor between actually Military Trail and A Street to improve coordination between the signals and improve progression. We are also working with FDOT on solving the issue with the pedestrian crossing signals on both northbound on-ramp and southbound off-ramp. The way those were built during the last DOT project connected those two signals, and when there's a pedestrian call on one of the signals, the pedestrian phase is activated on the other one at the same time, extending or prolonging the time through which, you know, right turns cannot be made to go on ramp westbound to northbound on ramp. So all of that is being worked on, and you should be seeing some improvement pretty soon. I believe I sent a notification to both Jamie and Mike about the progress of this project, and we are going to be wrapping it up very soon.
Okay, thank you very much. Vice Mayor Pro Tem.
Thank you, Madam Mayor. Thank you for the presentation. All I can say is, wow, this is pretty interesting. Well, I've got a lot of questions. let me start with some background questions. Number one, is this a done deal? This is going to happen?
Mhm.
It's done. It's cooked.
Yes, pretty much.
Okay. So did I miss something as far as the commission having input into this prior to the decision being made?
It came with
They,
workshop.
we had a alternatives workshop, and the commission members were invited, and also the TPA and the general public to attend the workshop and provide your comments. So far, we have not received any negative comments.
I was there.
Okay. So let's get down to some real interesting questions. It looks like you were talking about A Street and the level of service. If I was keeping up with the presentation, the level of service doesn't really increase or get better at A Street in either one of the scenarios. Is that true?
It gets a little bit better in the second one.
But it actually gets worse if you don't do anything.
It's worse if you don't do anything.
No, I'm talking about with either one of the proposed designs or whatever, it actually doesn't improve. I think that's what I picked up on, and maybe I'm wrong. The level of service doesn't get better at A Street.
Saying it went to a D or an E?
It went from an E to a D, didn't it?
Yeah, D is acceptable.
E to a D.
That's what we're shooting for.
It went from 55.8 or an E under the current configuration.
Right.
To a D.
That's no action.
To a, if we talk about the second one, it goes to 32.5 D.
Okay. All right.
And so it's almost in half, but it's degrees of hell.
I was looking at the color. I wasn't looking at the number. And when will this project be complete?
2 years.
When you say complete, do you mean construction or design?
No, the construction.
That is an interesting question. We have currently programmed construction to go in year 2027, but with we have the option of bringing it in sooner, depending on the funding. As you're probably aware, the department had a lot of losses in revenue from the pandemic, and so we're still struggling to reorganize our work program. But as it is right now, is in fiscal year 27, with the potential to go into fiscal year 25.
Okay, so I'm looking at this as being something that you want to take, the project gets us through 2045. So we were looking at 18 to 20 years of functionality. Is there a reason, is that normal for these type of construction projects?
Yes.
Is there no way you can buy more time to get us to 2065 or something?
Honestly, no dollars have been spent within this city's limit, I don't think, in the last 3 decades, practically.
Well, that's not a shocker.
Well, I'm just saying that these projects, when they come up, and I mean, we haven't been advanced. We haven't had we've had improvements on our I-95 interchanges and the exit ramps and stuff like that. I think that was the only project that we had in the city limits in the last 20 years.
Right.
So, to upgrade and update them, these designs, well, as high tech as they look in the videos that we're seeing, are being done in every city, and they're the standard new DOT, interchanges that happen everywhere across America right now.
What grade?
Pardon me?
And what are they graded at?
Well, no, I'm saying that these are the types that they are. But when we work and we hone into these, projects, no community ever likes anything, going in like this, and a highway certainly isn't a first choice for anything.
I'm not familiar. Is there something like this here in South Florida?
Yeah, I think there's another one in Boca, I think, just
Planned, I believe, 45th Street.
45th Street's getting one, and North
One in Boca.
Boca.
Where's that at?
Is it Glades?
I don't know, where's the one in Boca? Is it up?
West.
Glades is getting one in Boca.
It's getting.
They're all getting, yeah.
Okay, well, let's go back to talk about the kids, because that's really my biggest concern.
I think that's all of
It
it.
has been for years. In fact, 20 years ago, there was a glimmer of hope that there may have been a walkway actually created from the kids to walk, to get across the interstate safely, and that never came to fruition. But as I look at the design, I'm thinking, how do the kids, or anybody for that matter, get from the north side of 10th Avenue North, which is where the school is, to the center of this new design? I mean, it's just a function of a red light where they have to cross at the red light?
Yes.
It puts the crossings in a different, it's not intuitive when you look at it, but it's an elegant solution. Instead of walking across all the various things that they do now, they just flow to the center, go across, and then get back over.
It's actually less traffic.
It's less traffic, believe it or not. In New York, growing up as a kid, they actually put them over the highways. They put these raised walkways over it. And unfortunately, what happened is they became crime-ridden, dangerous.
Sure.
Private areas that police couldn't get to. And unless you had a guard in each one of them, at any given point of the day, they became dangerous.
And I know she said there were barriers, to protect against the cars, but it is possible to try a vehicle up from where you enter into that queue, so to speak, that walkway. Yes.
Yeah, but there's just as much possibility, in fact, more for somebody to come speeding up to the interchange of the northbound 95 on ramp with no protection there and going off the side and knocking out the pedestrians that are currently using that side.
Great at the middle school.
All right. Well, I guess that's all I have. Thank you very much. I appreciate the presentation.
Commissioner Robinson?
I'm puzzled as Commissioner, well, I don't know. For positives, I've actually experienced these divergent diamonds in Utah. And there's no pedestrian interest at all in the roads that this in Utah is on. So that said, it really does improve intersections. It's got to increase speed. Is that correct?
No, that's not correct, sir.
No, it slows it down?
Yes.
Oh, it slows it down?
Yeah, in this divergent diamond interchange, the design speed is 35 miles an hour.
I have a follow-up question.
Good luck. Boca's grading system, do you grade them all under the same criteria and everything? So are we getting a D, and is Boca expecting to get a D or accept a D?
Are you talking about the level of service?
Yes.
It all is dependent upon the traffic volume. So it's going to be different at every location.
President Trump has told countless lies despite.
I'm sorry. What did he?
No idea.
So the question is Boca going to accept a D level of service?
It's apples and oranges. It's apples. It depends what they're.
Well, it's still a D level of service.
Their roads are probably.
Is 45th Street going to be a D level of service?
I'm not as familiar with that interchange, sir.
Yeah, I'm sorry, Commissioner. I am not familiar with the level of service for those interchanges.
Okay, the kids are for. I'm going to say I wish the school was on the east side of 95. That would solve a lot of community involvement, safety issues, and probably development questions in the future. If we use some of our land north of 19th for a grand community school and less hazard to kids' traffic. With the studies that we do, why wasn't the study at least to the intersection, including the intersection of A Street? What you've presented was not really what's reality at any time. Turning north or turning west, headed north on A Street, or even headed any direction, headed south on A Street.
Commissioner Robinson, I don't think that their diagram or their diagram that they had or their animation that they had was designed to show how the traffic flows, not traffic flows, meaning not to show the traffic levels.
Right.
It was meant to just show how you go down the street and where you turn.
So we're spending time and money and not addressing an adjacent problem intersection. Regardless of the pedestrian concerns that we all have about the kids, A Street intersection and 10th is really a frustration. And, you know, I don't know why we have to go through this exercise and not address that intersection as well. It's disappointing.
These are federal dollars that are being spent in our community. And obviously the time that we've put into it is my time in TPA, Jamie's time, you know, working with the engineers and whatever. But these are dollars that are these impact fee dollars, Jamie? No, that's the county.
State, federal.
State. Yeah, so they're going to be spending these dollars in our community to improve things.
Yes, but have they improved the intersection of A and 10th?
Yes. By their classifications, they have, but I think
from an E to a D.
Well, we could sit here and go round and round, but the thing is that we can still talk with them. They're going to go back and they're going to look at it. It's not a done deal. Can we? I mean, what do you want to do? I don't understand. You want to just say no? We don't want to do this.
Yes, I want to do this, and I want to include the intersection of A and 10th.
Right, that's what we're talking about.
And well, it apparently there's a cutoff on input, and the response was it's a done deal. Is it a done deal? Apathy is always awoken after the fact. I mean, you know, now we're realizing what we didn't take notice to before. And
talking about what didn't we notice?
Well, all right, then express a real concern for the intersection of A and 10th. And if there's any way to.
Madam Mayor?
City Manager?
Yeah, Jamie, maybe you can help clarify. The intersection at A Street and 10th from the west side east, who owns that?
The intersection at 10th, you said from the west side east?
Of 10th Avenue, A Street, the intersection.
That is a city intersection.
Okay. This project is designed by FDOT. They're only stopping their design immediately at the west side of 10th Avenue's intersection at A Street.
They're stopping it at the west side of A Street, correct?
Okay. Yeah. The improvements that we're going to see in the numbers going from E to D is the effect of traffic moving more efficiently in the DDI proposal as it filters onto and around I-95. It'll free up space in that intersection. I think what we may do, and based on comments, and this has been a longstanding set of issues, and we've tried to grapple with it before, is actually have a workshop discussion focused on the intersection at A, what funding things are at, but it's not part of this project.
That's why I asked
we want to
for that
clarify
originally.
that.
That's what I'm saying. Our portion of the project is exactly what we can talk about, but that's what Jamie needs from an engineering. We've already looked at this through 3 different lenses, through the projects that came in and were denied in that area. So
that was just a one corner piece, but as Commissioner Bloxham said, you know, there's other turning motions in the mornings and at peak that are very difficult there. And what we probably need to do, along with our other road priorities, is look at that intersection, because you have to, as you heard earlier, you have to design it and get what that thing looks like, the solution. And then you can get the budget and start to ask for potential partnerships and funding. It's not part of this design proposal, though the intersection will benefit in flow in times of the light significantly, going from 55 seconds down into the 30s. Still a D, it's not great.
Right.
The other improvements you're looking for, I think, are a redesign of that entire intersection.
Well, that's what I asked Jamie for at the beginning of this conversation. Jamie, I said, could we come back and look at the impacts of A Street and 10th Avenue North, and can we make changes to it? That was the very first thing that was out of my mouth.
Absolutely.
Pays.
Well, it's a city intersection. That's why FDOT is not touching it.
Correct, which is the part that I was trying to explain.
And
It
I'm
wasn't
not
being-
touching it at any other intersection where a city or the county.
You can't touch it at any other
Yeah,
intersection.
because it's the interstate.
Correct.
And that's kind of just trying to really clarify that. But we should take a look at 10th Avenue.
We should,
Right.
yes.
Yeah.
And that's where Jamie comes in with that. That's what I was trying to say. Their portion of it, when you ask, is it done deal? Is it set in stone? It's their portion of it is that they're going to control. We've already, looked into those ports, but we can, as a city, make improvements to it that will enhance the numbers and bring the grade up.
And we'd have to find the funds to do the soft costs and the engineering
Correct.
to actually do a design solution.
And Madam Mayor,
Yeah.
just so everyone's clear, so it's a city intersection, but the actual signalization is Palm Beach County.
Correct.
They do the signals.
Okay. Commissioner Robinson, did you?
Well, at what stage is Boca doing, are they at? In their planning stage?
I'm sorry, Commissioner, I do not have that information. We can get back to you. We will have to ask the project manager.
Who owns Glades Road?
Who owns Glades?
Who owns Glades Road?
Who's on first? I guess it depends upon their traffic patterns, right? It would be different.
It's an ownership issue.
Okay.
I believe Boca Glades was starting, I'm not sure with everything with the code and everything, but I believe they were supposed to start in January with the actual construction,
Yeah, they were. So
if I recall correctly.
So what was can we find out what the grading was for the level of service at Glades? And just the level of service?
Yes, I do not have that information, but I can certainly find out what it is. But keep in mind that the level of service that you're discussing here is for a city-owned intersection. And the level of service that we look at when we look at the operations of the interchange are the ones that affect the operations of the interchange. A Street was analyzed along with the other intersections surrounding the interchange, and based on that, the models and the analysis, it was determined that A Street does not affect the operations of the interchange, and that's the criteria that the department uses for the cutoff point. Where do they stop the project? So I can get that information for you, but it's certainly different for every interchange. Every interchange is unique because their traffic patterns are unique to the local community.
And you grade them, but you grade them under the same criteria.
That's correct, but they are different.
And so if you're grading them under the same criteria, my question is where is Boca's grading versus Lake Worth?
I do not know. I can find out for you, sir.
I'm really interested in being as graded equally to Boca. That's all.
Yes, Commissioner. I understand your question, but just keep in mind that the intersection that you're discussing is a local intersection that does not affect the operations of the interchange.
Okay. Vice Mayor Pro Tem?
Thank you. I am sorry, I didn't ask this question earlier. To be clear, though, this is solely an interstate project designed to influence or impact, if you will, I-95. Is that correct?
No.
The primary purpose of this project is to alleviate backflow into the main lines of I-95, but also improve the operations of the interchange as a whole, including 10th Avenue North.
Okay. So as we talk about this, I'm wondering about a couple potential unintended consequences. For example,
Please, hold on. Vice Mayor Pro Tem?
For example, we many of us would probably agree that we have some traffic issues on some of our other streets here in the city, particularly Dixie Highway from the north, where we have a lot of traffic coming down Dixie Highway and cutting through across Worthmore, 24th Avenue North, cutting down D and A Street to get to 10th Avenue North. My question is, with a more efficient overpass, if you will, could it be argued that it would be done in such a way that would attract more traffic, more people wanting to use that overpass during the course of a day?
I will have to turn it over to our traffic engineers to answer that question.
The reason I ask is because if I could use the term attractive nuisance, that would be a concern of mine, because, you know, if this is going to be, you know, we got to look at our traffic throughout the city. And if we're going to bring in more cars on more efficiently through that overpass, my concern is more people are going to get wise to that, and we're going to come down Dixie Highway now, you know, and try to use that overpass, and which could ultimately end up with more traffic in the neighborhoods. I'm just trying to, it's my logic.
Yes, I understand your question, though we have no control of you know, what people decide to do.
I understand that.
But I can, Andrew, do you have an answer for that based on the models?
I think it's going to get.
Linda, you want to take a stab at that one?
Yeah, so we use a travel demand model that's specific for the region here in Palm Beach County. And the demand model works on several different factors, one being planned development and land use, and the other being the shortest path within the network. So when you have a build alternative and there's additional capacity built onto the road, or if the model sees a network that would be faster, it assigns an attractiveness to the vehicle. So when we ran and forecasted the volumes for this interchange area, all those factors are taken into account in our forecasted build volumes.
So is that short for yes, you're going to have an increase in traffic?
Sure.
If, you know, when the model was ran based on the traffic links, once, you know, the 10th Avenue interchange was enhanced, it took into account the additional vehicles that could be attracted to the interchange. So
Okay.
it's in our volumes, which is reflected in our level of service grading system.
Right.
Because as Palm Beach County continues to grow, the levels of traffic, unless people choose alternative forms of transportation, are going to continue to grow and to grow. That's why we're trying to get the train station and the local train on the tracks and other types of things, why we focus on investment in bicycle lanes. But no matter where we go, as long as they continue to invest in it, the traffic patterns will increase.
Okay, just worried about what's going to happen east to west of that. The 10th is just so congested.
I know, but
It's so congested, and there's not a lot of land between
I think that we
the interstate and Dixie Highway here in the city of Lake Worth Beach.
I think as a city, we can probably come up with some solutions in that A Street area that we can and not part of this
I
project.
don't want to, you know, belabor the point, but I'm looking at the traffic long term. And look, we're built out for argument's sake. So when you talk about growth in the county, it's going to be westward or up. All right. So there's only so many cars you could put through here. And I think we've reached capacity.
Well, those numbers that they gave were adjusting to the future capacity and coming in at those areas. We can not do anything and get another project in 20, 30 years.
As we end, though, we're going to get more cars.
I'm not trying to get a project.
No, I'm saying though, it's
the unintended consequence that we're going to have to make decisions on how we going forward. That's, I guess, what I'm trying to get at. And
More speed bumps.
Several years.
I've been trying to get speed bumps in my district for years.
Yeah, no, I agree with you. I think we're gonna have to address it as.
From Dixie to Federal.
All right, thank you very much. I appreciate it. Thank you, guys.
Thank you.
Thank you.
Thank you very much.
All right, have a great night.
You all too. Thank you.
Thank you.
I'm gonna move on to
Thank you for
the
being.
commission liaison reports and comments. I want to thank everybody that was involved in the MLK celebration, and all the events, and to everybody down at the community wall. And that, you know, we were supposed to be a setup day. I thought it was just going to be prep, and the artists were out there already starting to paint, so that was pretty neat. And just, I'm gonna bypass a lot of my stuff just because we've had 3 hours of presentations and we still have some issues to talk about. So Vice Mayor, you want to go next?
I'm gonna pass for
Commissioner Robinson?
time.
So, yeah, just quickly, the wall is turning out to be a wonderful thing. It demonstrates the community involvement. MLK was the same thing, fantastic day of unity. It's Lake Worth Beach. The racial equity was eye-opening. A lot of people said the staff was really good at participating, and good to hear their comments. Looking forward to some workshops on the short-term rentals and public-private partnerships. Looking forward to our development at the roundabout that was approved by this, or beginning of development at the roundabout. That's going to be a monumental importance to our entrance to the city, and look forward to its success. Thank you.
Thank you. Vice Mayor Pro Tem?
Thank you. Again, the weather was absolutely perfect yesterday for the MLK celebration, and another job well done by the MLK committee. You guys really rock. You really do a really nice job. I really enjoyed participating again. We just recently gave a proclamation to Patrick Livingston, Arms of Hope. And, I've had some ongoing conversations with him about his plans for the future and what they're doing down there. And, this pandemic has really put a strain on not just his operation, what he does on a normal course of business, but a lot of the food distribution, food bank type of things. Anyway, he and I had a conversation, and he's very much interested in trying to, what's the word I'm looking for, revamp his operations, if you will, to make it a little more efficient for all parties concerned, recipients of food, etc. Anyway, he's interested in putting in an awning system on the front of his building, and he'd like to possibly do some temporary removable tables. So when he serves his hot meals, folks aren't necessarily sitting on the sidewalk or leaning up against the building, that type of thing. Anyway, he's going to be approaching the staff, I guess, to see if that's doable in terms of permitting and all that. I'm just wondering if I could toss the idea out there that maybe if he gets to that stage where he wants to put that awning system in or whatever, and then the staff says, yeah, this is something we can do. I'm wondering if we might want to consider giving him a little financial relief on the permitting fees or whatever. I don't know if the commission feels about that, but I just thought I'd toss that out there just to give him a little bit of help, a little bit of, support. So I just want to throw that out there for everybody to think about.
Okay.
Thank you.
Commissioner Bloxham?
I want to thank everyone for their participation in the Martin Luther King festivities as well as the wall. I've been the artist chair, and we had 15 artists to come in this weekend to start their projects. I understand that there was a lot of concern regarding one of the projects and one of the slogans that were on the wall. We want you to know that we listen to your concerns, and there are going to be changes. But we're going to have a meeting tomorrow at the Osborne Center at 5:30, where we're going to continue to talk about the vision for the wall. This Saturday, when people come to paint, it's going to be people from the community that'll be able to paint as well as new artists. So please come and be a part of the solution. We understand that everybody makes mistakes and makes missteps, but to be able to admit your mistake and say, let's move on together, that's what's important. And that's what we've done. So please visit us tomorrow at 5:30 at the Osborne Center to talk about the changes and to talk about your concerns, but also talk about how you can help. Thank you.
Thank you very much. We have public participation.
Oh, I had a question. Does that constitute a public notice for commissioners to show up, more than one?
You're not.
Say that again. I can't hear you.
Madam Mayor, the question was, is there going to be a need to advertise it if more than one commissioner comes? If y'all don't have a conversation and you listen and don't participate and talk about anything that may reasonably be coming for you for a vote or policy decision, you're fine. we don't own the wall and we're not part of the committee. If you're there just attending, it would be like any other meeting.
And if you're not going to vote on anything,
A policy question.
then we could comment.
We're not, I think there's a misconception that, I'm sorry.
No, go ahead. Go ahead. Finish your line, John. But again, in the future, we usually don't go back and forth on our comments. But please address it so that you can.
I think there was a misconception that the city was somehow in charge of the wall, or the city had some sway over the decisions that were made. The only thing that the city did was to help us with the construction and the architectural aspects of the wall, making sure that we were doing things properly. We never had a chance to say, this is what should go on the wall, this is what should not go on the wall. That was not a citywide function. It wasn't a function of the committee, of the commission. There is a group of people who live in that area and people who are stakeholders in that area, and they vote to decide what goes on the wall. You can't expect the city commission to make a decision for something that they're not really a part of. And we were not a part of the decision-making process.
Correct.
Thank you. Perfect. I appreciate it. Okay, public participation of non-agenda items and consent agenda, Madam City Clerk.
Yes, Madam Mayor. The first one is from a Melissa Salerno, 501 South N Street. Painting "All Lives Matter" on a wall whose original purpose was to separate and segregate the Lake Worth Black community is the modern day equivalent of erecting another wall. The utter ignorance and tone-deaf statement demonstrates a complete ignorance and creates the opposite effect of unity. Shame on whoever approved that message. It is disgusting, hurtful, and appalling. The next one is from Renee Hoyt, 1702 North J Terrace. I am beyond mortified at the thought that "All Lives Matters" could possibly be painted on the Unity Wall here in Lake Worth. The city has defined diversity in my mind, or I would not have moved our family with our Black son from our diverse town in New England to this part of Palm Beach County, Florida. This needs to be rectified immediately, and the wall representing unity needs to know what unity means if it is expected to represent the thoughts and wishes of our residents and our community. The pictures beneath the words only demonstrate it further. Black people below "all lives" on the wall. This was a terrible representation of Lake Worth culture and diversity. The next is from Angie Wegner, 235 Gardenia Isles Drive, Palm Beach Gardens. I am opposed to the "All Lives Matter" mural on the Unity Wall. The idea that Black Lives Matter is too divisive for a wall that physically separated the races is laughable. Save us your racist slogans. They aren't made less offensive by the inclusion of famous Black people. Also, having a white artist address this issue really seems to be missing the point. Are you even really trying to make amends or write history with this? It's shocking to me that this was approved, and I fear Florida, being Florida, is going to end up being ridiculed in the national spotlight. Colbert or John Oliver. The next is from Marina Desiderio of 230 Cornell Drive. "All Lives Matter" is as tone deaf as stating "all cancers matter" at a walk for one of the deadliest cancers. It is essentially a slap in the face, as we know it's meant to undermine the importance of why Black Lives Matter and why people have been peacefully protesting since Trayvon Martin and Martin Luther King Jr. I would also like to add all my emails and voice messages have gone unanswered by the mayor's office, and her assistant once answered my call about an unrelated issue, telling me she will inform the mayor and get back to me. That was over 6 months ago. We should have better communication between our elected officials and truthfully feel like our voices are heard beyond voting. Thank you. And the last comment is from Cheryl Rashkin, 1302.
I have Cheryl Raskin in public. I have her online.
She says here she wants to read her comments. She wants me to read it into the record. Do you want, does she want to speak now?
Can I ask her really quick?
Absolutely.
Hey, Cheryl, I have you, Ms. Raskin, I have you, do you want to read your comment or would you like Deb to read it?
Cheryl, you're muted.
Looks like she's still muted. So I did give her the opportunity to talk. So if you want to go ahead and just read her comment.
Okay. Good evening, Madam Mayor, City Commissioners, and staff. At a recent South Palm Park Neighborhood Association meeting, we discussed the need to have several traffic calming devices installed in several locations on South Palm Way and South Lakeside Drive, along with the main entrance avenues, 6th and 18th Avenues, from South Federal Highway into the neighborhood proper. In working with the neighbors, I have a list.
Keith, turn off your microphone. Keith, turn off your microphone.
I have a list of several locations that we feel will meet the needs of the neighborhood residents, and I am ready to work with city staff to make this happen. We know that this will not happen overnight, but we do know it will happen as you, our elected officials, and hardworking city staff wish to see all the citizens here in Lake Worth Beach are safe. I look forward to working with Mr. Brown and his staff to make it happen. Thank you, Cheryl Rashkin, President, South Palm Park Neighborhood Association. That's all the comments that I have, Madam Mayor. Thank you.
Okay, thank you very much. Moving on to the consent agenda, I'll entertain a motion.
So moved.
Moved by the Vice Mayor Pro Tem, seconded by the Vice Mayor. All those in favor state so by saying aye.
Aye.
All those opposed? Motion carries unanimously. Thank you, guys. Public hearing, this is ordinance number 2020-21. City Attorney, would you read the ordinance, please? And again, this is a second reading. The presentation has already been done. If you need a refresher, please ask staff. If not, we can vote.
Okay, ordinance number 2020-21 of the city of Lake Worth Beach, Florida, amending chapter 15 offenses and miscellaneous of the city's code of ordinances by creating a new article 8 to be entitled Prohibition on Distribution of Plastic Straws at City Facilities, providing for exceptions, education, enforcement, and penalties, and providing for severability, conflicts, codification, and an effective date.
I'll entertain a motion.
So moved.
Second.
Seconded. Okay, we got a motion and a second. Are there any public comment cards?
No, Madam Mayor.
Being there are none, are there any questions? Commissioners, I know Ms. Bloxon, you're okay with that? Okay,
Aye.
we've got a motion and a second. All those in favor state so by saying aye. Aye. All those opposed? Motion carries unanimously. Thank you. Moving on to new business, item A, resolution number 02-2021, establishing the city's charter review committee. Moved by the Vice Mayor Pro Tem. Do I have a second?
Second.
Second, okay. City Manager?
Madam Mayor, this is at the direction of the commission to bring back a committee to actually go through the charter and to provide you a comprehensive review lasting for 180 days, which can be extended if need be. Basically, each one of y'all would get to appoint one member the way it's currently configured by the attorney.
Okay. I'll entertain it. We have a motion and a second. We had a motion and a second. Okay.
Second.
Follow-up comments, Commissioner Robinson?
With the understanding that we would be able to come to something to be put on the ballot in March of 22.
And Madam Mayor, the commission has that function of putting things on the ballot and taking the recommendations to the committee. So that would come from this body.
Right.
Yes, sir.
But with the intent of the timeline to establish a December deadline for the March ballot of 2022.
Yes, sir.
It does say that.
Yes.
Yes.
Yes, sir.
Yeah, it's in the backup. Yeah, thank you.
Well, the public. Good.
Okay. Vice Mayor?
Quick question. So in the past with our boards and our groups, we haven't given them very clear direction. Does this give them clear direction on, are they looking at something specific? Are they looking at the entire charter? Are they, making things up to be put into the charter? What are the ramifications for clarity? Are we giving them direction? Or are we just giving them a carte blanche How is it?
The way it's
present?
currently constructed, Madam Mayor, if I could,
Please.
it's basically broadly sets up the working group. If y'all want to make some suggestions to put into the work program, it would be our intent to give them good guidance on the charter and the process and all the legal aspects of their job to fulfill within 180 days. But if there's specific things that you want to see them.
Well, the reason I'm, Madam Mayor,
Yeah.
Yes,
the reason I'm asking is there is clearly already a group established that has been working on, they came to me and they've been working on things. So, I'm not talking out both sides of my mouth. I have heard from a group that are clearly working on some things. So is it something that we're going to look for that direction or those things to come forward, or are there other directions we're going to give them? I just want clarity. So the working group, the people that are already working on something, either come forward in some form and present so their work has not gone without, or do we start from scratch and,
I guess the best thing to say is it's a committee and not an advisory board. So the questions, Glenn, I would have for you are, number one, do they serve at the pleasure of the commissioners that appoint them?
They would serve at the pleasure of the entire commission because each commissioner selects one person subject to ratification by the whole commission.
The whole commission. Okay, so they serve at okay. And then the other thing is, are they going to be subject to sunshine, just as we are?
Yes. Yeah, they'll be subject. We'll do a presentation on sunshine and public records. And
Okay.
if I could, back to Vice Mayor Amoroso's question, since they're a public meeting, any group that or citizen that's got ideas can certainly appear in front of this committee and present their ideas.
And who is the staff member that will liaise this organization for their meetings?
Well, Madam Mayor, obviously the attorney needs to be involved in this because it is crafting to your charter. And then we would probably work through the clerk's office to figure out who's going to actually.
Just thinking of the logistics on it. Okay, thank you.
The start date or when we're going to bring forward names is not.
Well, technically upon completion or adoption of this, you can move forward with starting to find people who may want to serve on it and bring them forward.
So there's no deadline for establishing, I mean, if we only get 4 responses or 3 responses, is there a process to fill in the other 2 or 1 or 2?
Are we going to use the same rules as we do for the other advisory boards? Meaning that a commissioner has X amount of time to fill the spot, and if they can't fill the spot, it moves to another commissioner?
That's
that's what I figured you were asking. I was just trying to clarify it for.
Thank you.
In lawyer speak.
Well, there's actually a blank in section 1 that says shall be ratified by the entire commission no later than blank date. So if you set a date, that will be kind of the deadline that everybody's got to bring their choices to the commission.
But traditionally we have 30 days.
Yeah, traditionally we have, if the way the other boards work, we have 30 days. And if we go past that point and I say I can't find anybody to fill that board in that position, it would go to the next commissioner that would be able to appoint that position and hopefully have more luck. And we did that intentionally because people were leaving the boards or quitting the boards or being thrown off boards for non-attendance, and we couldn't get the boards filled fast enough. So this was
Don't have a problem with that.
yeah, we're still having issues. Still not perfect.
So you
do we
have
just keep it?
Madam Mayor, if I may, you have a meeting on February 16th, which is a little less than 30 days. And then you have another one on March 2nd. If you want to fill in one of those dates, that way that meeting is when it'll be done. And March 2nd gives you a little bit extra time, it's maybe 37 or 38 days.
Okay. Okay.
Well, and the public is going to have to put in an application.
With Sylvina, as usual?
Yeah. Do you
Okay.
want to put in the March 2nd date?
Yes. You guys good with that? In a month? Okay.
Okay.
So do we need to revise the motion, Glenn, to include the March 2nd date?
No, because you just, to me, that's included in the motion.
Okay. So we've got a motion and a second. Is there any public comment cards, Madam Clerk?
No, Madam Mayor.
Seeing there are none, all those in favor state so by saying aye. Aye. All those opposed? Motion carries unanimously. Also, let's see, item B, discussion about Education Advisory Committee.
Madam Mayor, this item was brought back after discussion when School Board Member Erica Whitfield did a presentation to the commission. And it was suggested that she go and speak with the community, the NAPC. That meeting, which is attended by Commissioner Robinson as the representative and myself, I sat in as well, to listen in on her interactions and suggestions of things that she wanted to do to get interest in the community to form a committee that would focus on educational issues, especially from the neighborhood association aspect, and to help out the local schools. She went over that, and I don't know, Commissioner Robinson, if you had any comments you wanted to add to.
No, there was interest, but, you know, if you want to get something done, you talk to a busy person, you know, and those people are involved. They were enthused, but didn't volunteer immediately.
So it's a work in progress, Madam Mayor, basically, but we did want to bring that back. To segue into the other piece of this, and I apologize if it's confusing, but there was an email that Erica sent back to y'all about some of the things, and I think you were involved on the email chain, that talked about some programs that you may want to do, and it included recognizing teachers and recognizing students, which you.
Well, that was the thing. She and I had a conversation about this, and we had thought of some ideas through the Mayor's Education Council, which is, you know, which we operate basically to keep the communication lines going between the teachers and school principals and people that work within the schools. So we haven't met. We're meeting next month, and Erica reached out to the principals to let them know that she and I were working on these things, and it kind of got coupled in with this other one today. But two of the things that were really of major concern to Erica in our schools alone, you know, a lot of other ones too, but mainly our biggest issues were attendance for both online kids and brick and mortar, you know, in the schools themselves. And they were having a really, really hard time with that. So we talked about an incentive program, a rewards program for having the highest levels of attendance, either online or in person, in the forms of Fun Depot rides for the kids, public supermarket gifts, or Winn-Dixie or whoever supermarket gift cards for the kids, and different kinds of programs to encourage them to compete against one another for better attendance rate. It's something that schools have done in the past, but again, with no funding at the schools at all, it's been an issue. The other thing was to basically go to our local merchants in downtown and across the city to offer services that are available right here in our city for two reasons. That and a recognition program for our teachers. Erica has been talking about that with me for years and saying that, you know, other cities do it, and the schools, we're not picking these people, the schools are actually picking them. And most often it's teachers recommending other teachers that have gone above and beyond, you know, their own pocketbooks, their own time, their own treasure, their own whatever. And they have this nominating procedure. And then again, that could be a spa gift certificate, a restaurant gift certificate, or whatever, and recognition at our city commission meeting that they are some of the star teachers in it. They sound very simple, but I will tell you right now that the morale amongst our teachers in our schools right now, and the conversations that Erica and I had, it was not good. And I think does it sound like fluff? Possibly. Are there bigger problems in our school systems? Sure. But I think that if one thing that small governments and small cities do well is recognition of people within your community and giving them a chance to shine and letting them know that we care. And Erica feels strongly about it. I do too. I will try to get as much of whatever I can get raised through donations from businesses in the community. And I'll do that myself to help with this. And anyone who wants to help me, please let me know. I would love that. But if there are some financial rewards or things that have to be purchased for the kids or the teachers, since, we're not traveling as much, if we could use, we're talking about a couple $100 here or a $500 reward or whatever they may be, or gift cards or whatever. I wanted the ability to use some of that funding for these gifts, and I will try to get them mostly covered by trade and it all covered by trade if possible. But I wanted to bring it to you just to make sure it was okay that if we had to do that. Does it, Vice Mayor?
I just had a couple comments. So is the school board going to pay for any of this? Because you had made mention that other cities have done it. I'd like to maybe see their blueprints instead of, starting all over again, kind of see what they're doing and,
It's the cities themselves are doing it for their teachers because we're not connected to the schools like the city I grew up in. You know what I mean? It's not like the city makes the decisions, the educational decisions. We have a school board that makes those decisions. But, in every way, they seem, the teachers and stuff, especially when they come here, they're reaching out to us and they're looking for a lifeline right now.
Well, and I have no problem helping with the downtown merchants and, funding if we need to, but you have mentioned taking out of our travel budget a few times on different issues. I want to remind this board that I still sit on quite a few boards and I still travel.
I understand.
I'm not traveling as much, but I'm still travel based on the needs of the boards that I sit on. So we mention it from the dais, but we never look to see what the funding actually is. So
well, it's a pot. Unfortunately, it's not separated out into each individual.
I totally understand that.
Yeah.
But we quite often say, we'll dip into this pot. We just need to make sure, that we do everything we can to reach out. I totally support it, but I'm still concerned that you have the mayor's what is it called? Mayor's
Education Council.
Correct. And now we're looking to set something else up. I always thought all these things would go through your because you've built that rapport and you've had those.
I would like to do that and bring in, I would like very much so, but it was brought up that people wanted something, a different anomaly of this, of this type of project that was really just community based.
But
So
we've heard that we may or may not be getting that support.
right, then I think we should expand the Mayor's Education Council at that point
Exactly.
to pick up the slack
and try to,
and invite the community,
come forward.
invite the people in the community if they want to be a part, to be a part of it. Yeah.
And then use their talents or their, strong points to help, get to where we need to be.
And I don't mean to, I didn't mean to take away from, because I know you're still traveling and everything, but I haven't traveled in 2 years now.
No, and I just wanted to make a point because we said multiple times that we would take out of that, travel budget.
Yeah, I meant mine. Sorry.
But again, like
My
you
budget
said, it's
alone.
one big pot. I just want to make sure
Yeah,
that.
Madam Mayor, if it's comfortable, I do have certain expenditure authorities. I can look, find and make sure everything is addressed appropriately based on the needs. Looking at travel budget.
Take mine, and mine's enough for it. That's fine.
Take a look at that as we come up with the budget. Thank you.
Yeah. No, I just want to, I just think there's a lot of good, we talked about bringing the parade back, the homecoming parade and other things. Now we're in a COVID environment, I understand, but I think sometimes, it's not the big things always. It's the small things that we can do that make them feel the love a little bit more. And I think we can do a better job at it. And especially now in a COVID environment, I think it will mean twice as much as it would have ever before.
Well, and I just wanted to mention too, she had reached out to me on some food needs.
Yes.
And, I'm working with North Grade already. My car is actually full of food that will go to North Grade for their food pantry. So, North Grade has reached out and, I'm waiting for others
Okay,
to
good.
fill their pantries.
Yeah, I just think that right now, let's be good at what we're being, let's be good at what we're good at, being good neighbors. Thanks, guys. I appreciate that. All right, moving on to Lake Worth Electric Utility. Still here? Did you fall
Yes.
asleep?
Yes, we're still here. The lights are still on. It's
Okay,
good.
good. Hey, hey. Being Italian, welcome. Hey, oh.
Okay, thank you, Madam Mayor and commissioners and the rest of the folks present online and in the room. The primary thing I wanted to talk about tonight was pleased to announce that we have entered into a letter of intent with Florida Power and Light to build an additional tie line into the city of Lake Worth. So that's quite a momentous occasion for us and we're quite busy at it. We've been quite pleased and very, very proud to say that we've been helped tremendously by FMPA, the Florida Municipal Power Agency, and also for the work that FPL has done to help get a document to this point. I won't speak for FPL, they'll speak for themselves at some point, but we do greatly appreciate what they're willing to do and the spirit in which the letter of intent was achieved. So to tell you some things about this letter of intent, it is a letter of intent. It is not a final document. It is not a signed contract, although it is very, very strongly worded and very well supported by both sides. It is executed jointly between the City of Lake Worth Beach, Florida Municipal Power Agency, and Florida Power and Light, and also the City of Homestead by officers and management leaders in each of the organizations. You might ask why the City of Homestead. I'm not speaking for the City of Homestead either, but they also have a project that's involved in this letter of intent, and therefore the portion of the document really belongs to Homestead. So with respect to what we've agreed to do, we've agreed to work in good faith towards getting a second tie line into the City of Lake Worth Beach. Each party will bear its own costs. FPL will bear the cost of extending their system, and we will bear the cost of preparing or receiving that tie line. That point will be at the Canal Road station, sometimes also referred to as Davis Road, which is in the unincorporated county where we have a 138 kV connection today. The major points there, we've started to exchange documents already. We've exchanged one-line diagrams, site information. We've been holding regular meetings with FPL's design engineers, transmission engineers on this matter. And we have the draft of what's called a scheduling document, which we'll be executing and sharing this month and executing with them as well. I just want to point out that through this whole process, FMPA, their executive officer group has been very, very supportive and a part of the team that helped to make this happen. So their CEO, their general counsel, and chief operating officer at FMPA were heavily involved and helped make this this dream of ours come to reality, or at least get down a very serious path. There will be additional documents that we need to execute as we go through this process, as we firm up the design. Obviously, each party will be having to purchase materials, release construction contracts, and do permitting associated. We will work with FPL to help them achieve permits down the road. And some of our facilities, depending on how the design works out, will be co-located, and we may be doing some work where they'll set a pole where we currently have a distribution pole, for example, and we'll transfer our distribution facilities onto that pole. So there's a lot of very nitty-gritty work that has to be done in the engineering design to get into those level specifics, but everything is marching down the path very, very well towards having that happen. As I mentioned, we are meeting at least monthly. We're also exchanging our engineering standards, obviously, or maybe not so obviously, where we do attach to an FPL pole, or they set a pole for transmission and we attach distribution, we will comply with their construction standards to minimize our impact on their facilities as much as possible. We also have a date in mind. We've agreed to a December of 2022 as a date when we would seek to have this new line in service. From an engineering operations point of view, this is eminently doable. The design will look much like what we have today at the Hypoluxo substation, where two FPL lines come in, loop through the Hypoluxo station, and then serve cities to the south of us with a loop through our station. The Canal Road station will look much the same. The FPL lines will come in and loop back out. So we'll have two FPL lines serving us at Hypoluxo, which we've had for many, many years, and we'll have two FPL lines serving us at Canal, which will be new. And then we have our single tie line that goes from Canal to our main yard, and then from our main yard down to Hypoluxo. That will be a continuous loop. We will have a breaker in the center that can be opened to basically create two different systems of radial nature. But we've asked, and FPL has agreed, that that will be normally closed, meaning will be a part of the loop, and there will be loop flows of energy through that tie, which will improve reliability, not just for us, but for their system as well. We have formed a special project team to bring this project to fruition. And it encompasses folks at the highest levels from a legal point of view, who will handle legal issues, not because we have problems or anything, but there are legal things that have to happen as well, and all the way down to the construction side. So I'll just give you a general overview of what that team looks like. General counsel for the team will be Jody Finklia from FMPA, who's the FMPA General Counsel. He has helped us through many of the legal issues because there's many FERC jurisdictional issues here. And Jody Finklia is well experienced in those. However, Christy Gatto from our own city attorney's office is involved as well. And Christy is in the loop on all the documents that we exchange from a legal point of view. Project manager for the project for us, we've selected FMPA, specifically a gentleman by the name of Carl Turner. Carl Turner from FMPA will serve as the project manager for the new transmission station, which will be built at Canal Road to accommodate the incoming FPL lines. We've also have a power engineering function, Power Engineers, who's an entity that we've selected through our CCNA process. Power Engineers was involved with us in doing the conceptual work early on in the tie line, and is currently doing additional conceptual work to nail down projects costs and project schedules for us to work with. Power Engineers may also be involved with the protection that is required. I don't mean by security, I mean how the relays and how the equipment will be protected electrically. And that's a firm that both FPL and Lake Worth Beach use, so we have a good basis of a relationship there. Our transmission engineering manager, David Martinuk, is assigned to the project as well. He'll be working very closely with Carl Turner, vetting the various designs with Power Engineers, providing the spec that we have developed so far for transmission, and also our distribution and feeder attachments that we may have to FPL poles down the road. Project support will also be internal. Project engineering, cost and scheduling, coordination will be done by Paul Nicholas from our own staff. Construction management, that's boots on the ground, overseeing the construction, not managing the construction, but overseeing it from a quality control point of view, helping us review the design specs, construction specs, and ensuring that the construction on our end that we're responsible for happens according to our spec. Will be Mark Mezzincello, who will be selected. Mark is our member of our Electric Utility Advisory Board. He, of course, would step down from his role in the advisory board and will be working part-time for the city through his company in a construction management role. Some of you may know Mark, but Mark has many, many years of experience building facilities like this in the Northeast for utilities in the New York City area, and is now based here. On the materials management side, helping us procure all the materials, stage all the materials, get everything that we need, and make sure that we have adequate spare parts, commonality materials, will be Tom McKee from our own utility side. He manages our warehouse operations, materials management functions. Tom McKee will take care of the materials. And of course, not to be overlooked is the role of the Lake Worth Beach Procurement Department and our finance department, which will be heavily involved. So we've got a pretty stable team to go ahead and execute on this. I'll point out that in addition to building the new 138 yard breakers, switches, protection equipment, control house to accommodate this, we'll also be building a new 138 to 26 kV substation at the site. There's a substation there today with a single transformer, which is quite old now, 40 plus years old, which for many of us doesn't seem like that old, but in the transformer business, that's it's time to consider replacing it. So if you will, we'll be building a second yard there, and installing at least one, probably two new transformers, which will greatly aid and assist in improving distribution reliability and getting after the projects that are on the SHRIP project list. So I just gave you a big mouthful to chew on. Also want to thank the mayor for support through this process. These discussions took quite some time and very delicate in nature. And it was very important to know that we had that support. So thank you, Mayor. And now I'll open for any questions that we may have.
Thank you, Ed. I want to thank everyone too at FMPA and from FP&L. This has been a worry of ours for many years, especially through, it's always brought out during hurricane season and everything else. But what about when we had problems with things, in our old utility system, thinking that if we didn't have another tie line, we were going to have a problem. We weren't going to have power. And we didn't have a backup. We didn't have anything. And it's been also with huge cost. So having partners involved in helping us with this is, hey, right now, I'm just so pleased that we're developing partnerships and we have such a professional staff and team and everyone on board that we can facilitate this, we can make it happen. And we can also increase our reliability and other things throughout. But this is a real wonderful, wonderful teamwork project. And I'm glad to have been a part of it. And I'm grateful, most importantly, Ed, for you and your staff. And again, to FMPA and to FPNL. We're glad to be partners.
Thank you, Mayor. And again, I'll stress that at this point, we still have a lot of work to do to get into more final definitive agreements and, of course, finish the engineering. We overcome approvals.
Well, hurry up and get busy. I only want to have to go through one more hurricane season without this thing. Vice Mayor.
Yeah, I just wanted to mention too, Ed, I wanted to thank you and your staff, and we really didn't focus on it, but this is saving the taxpayers a lot of money because originally when we looked at this, we were looking at paying for it and trying to figure out how to pay for it. So I want to thank you and your staff for going above and beyond and FPNL for partnering. And, again, just great job. Thank you.
Thanks so much.
Can I just point
Sure.
out too, because as the manager, I just really want to recognize and compliment Ed and his team and the FMPA staff. And, when we were talking the other day, I know we were talking about the committee when we were coming out of FMPA originally to go to look for power providers. We were crowding out was the term with Sue Hersey.
Yep.
And things were just so crazy, it seemed, in those days. And one of the hot issue was, well, it's been talked about since the 80s, a second tie line. And now to come to this point and to have seen and been part of the conversations and working with Ed and his crew, I can't say enough about the importance of this city attracting and retaining quality, competent, experienced staff. We've experienced tremendous stability in this department because finally getting the people in there led by Ed with his tremendous experience, knowledge, and leadership skills is making a tremendous difference in your electric utility. And I'm just busting with pride. This is a seismic announcement. I know it's after normal times, but this should be a story that everybody hears about. This is a tremendous accomplishment, and I'm just very proud of the staff and Ed's team. It's amazing.
Thank you. All right. Hey, team. All right. We've got a consent agenda item on there. I'll entertain a motion. Second?
Second.
All those in favor? Aye. City Attorney, do you have a report?
Only to wish everybody a happy and healthy new year.
Oh, thank you. Nice to see your smiling face.
Good to
City
see you
Manager?
too.
Just really quickly, you brought up the race, equity, and leadership process. While we had the two sessions, there is follow-up meetings occurring with staff because the leadership team internally of the city staffers that participated, there's a follow-up process with them internally. There's also an outward-facing component that we'll be pursuing in partnership with Healthier Lake Worth. And it's ongoing. I talked to several of you, and there seems to be some interest in bringing back a proposal for what's known as Real 102, which talks more about some of the toolkit and those kinds of activities and things. It's been said many times, this is a process, not a destination. So we're continuing. We have the same commitment that you've told us to pursue. It didn't just stop with that. So I want everyone to understand that the real process is still very real.
Good. Awesome. I'll entertain a motion to adjourn. Second?
Second.
All those in favor?
Aye.
Aye. Thank you, everyone.